Some funds were raised entirely for the sake of helping the suffering humanity. I decided to spend that money on the poor people, and that is exactly what we're doing.
Humanity First began its journey in 1995, reaching out to rebuild lives shattered by disasters and despair. And from that legacy of service, in April 2017, a new life began. HF Healthcare, a dream to build and manage hospitals in the world's most underserved communities. It was a leap of faith, and that faith was blessed when Hazrat Khalifatul Masih V, may Allah be his helper, personally inaugurated Nasir Hospital, the only Humanity First project he has ever inaugurated himself, while hoisting the Humanity First flag for the first time.
The effort of the Ahmadiyya Muslim community to serve humanity in all parts of the world are entirely motivated out of a desire to ease the suffering of mankind, and this is why Humanity First is today opening its first hospital in this part of the world.
The challenge was immense: to create a model of sustainable, affordable healthcare that is equipped to help those who could not afford to pay. And all these years later, that dream not only survived, it flourished. Today, HF Healthcare stands as a symbol of what faith, determination, and service can achieve together. Since its inauguration, HF Healthcare has treated over 90,000 patients, generating more than $15 million in healthcare revenue. Through this sustainable model, we've been able to extend free and oftentimes subsidized treatment to over 21,000 underprivileged patients, ensuring that care reaches those who need it most. But these are not just numbers. They are 90,000 stories. Stories of mothers who found healing, of children who laughed again, of lives touched and transformed. And as we heal, we also grow. In November 2021, we broke ground in West Africa, where the Masroor Center for Healthcare is rising in Abidjan, Côte d'Ivoire, a state-of-the-art facility designed to serve thousands across the region. Its completion will mark the next milestone in Humanity First's global health mission. In Tanzania, plans are underway for a state-of-the-art eye hospital in Dodoma, a beacon of light and hope for thousands across the region. And back home, the Nasir Hospital continues to evolve with the opening of a new inpatient block, expanding our capacity for surgical care and critical services. Launch of HF Pharmacare, connecting our patients to affordable and quality medications, while our first satellite clinic in Chimaltenango brings Nasir Hospital's care closer to remote communities. Through our partnership with Loyola University's Department of Ophthalmology and Gift of Sight Missions, over 100 successful eye surgeries have restored sight. Currently, the hospital is gearing up to launch its state-of-the-art intensive care unit, as well as a fully functional dialysis center. Next year, our vision expands even further, with mobile health units ready to travel deep into the heart of communities across Central America. As Humanity First marks 30 years of service, HF Healthcare looks toward Vision 2030 to build a cluster of hospitals across Africa and Central America, each one serving as a center of healing, education, and hope.
To the Humanity First USA 13th Annual Telethon. We will start with Tilawat by Hafiz Saeed.
Assalamu alaikum wa rahmatullahi wa barakatuh. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. ويطعمون الطعام على حبه مسكينا ويتيما وأسيرا إنما نطعمكم لوجه الله لا نريد منكم جزاء ولا شكورا. Translation. In the name of Allah, the gracious, the merciful. And they feed for love of Him, the poor, the orphan, and the prisoner, saying, we feed you for Allah's pleasure only. We desire no reward, no thanks from you. Surah Ad-Dahr, verse 9 to 10. Assalamu alaikum.
Jazakallah Hafiz Saeed Sahib. And now we will have dua by Amir Saab, Cote d'Ivoire, Amir Saab Abdul Qayyum Pasha Sahib.
दुआ कर लें. Ameen.
Jazakallah, Amir Sahib. So Munam Naeem Sahib is the chairman of Humanity First USA. You know, we've been doing this a long time, 13th annual. We've done it at Beth Rahman. We've done it in a couple of different locations. This is the most unique. We're actually in Cote d'Ivoire, in Africa, at the Masrour Health Center. What are we doing here?
Okay, I think this is an amazing story of the growth of Humanity First organization. We started out as 30 years ago, Humanity First was established, and from there on in USA, we were established in 2004.
2004, okay.
So technically, this is our 23 years, although the telethon you said is 13 telethon. Yes. But in 2015, as Humanity First was growing and building itself, doing those 7 or 8 major programs, as we all know, right? You know, there was a healthcare segment that
a lot of your work, a lot of the work of Humanity First has been healthcare.
Yeah,
right?
exactly, medical missions and smaller clinic. But what we the request came in to build a hospital in Guatemala, and that was one of the biggest undertaking that entire Humanity First had ever taken.
And for those challenged Americans who challenged with geography,
right.
Guatemala is south of Mexico and Central America.
Central America, right? And I think is so as we were trying to figure out that how do we take this undertaking of this building a big hospital, what are the liabilities, what are the issues, and how can we? And we needed somebody.
And this hospital was assigned for Humanity First USA to build by Hazur Aidallahu Ta'ala bin Nasir Aziz.
Right. So one of the government official, congressman, senator, I forget whoever that was, that he was visiting London, and he laid out the pathetic conditions of the medical field in Guatemala, and so that basically drove the request. Guatemala was assigned to Humanity First USA anyways. We were doing many other projects and programs there. So from that perspective, that project, was assigned to us. And it was a big undertaking. We had never raised that type of funding and that type of program.
And we've never built a hospital before.
Never built a hospital.
I know you're very good with airplanes, but hospital is different.
Yes.
I heard it's the second hardest thing to build after nuclear plants.
That is true. And not to mention, we had a lot of doctors also. I mean, there's a large medical professionals, doctors that are in USA.
Oh.
But building a hospital was something. Anyways, we engaged, and Majid Khan, who had an experience in building hospitals in past, Tahir Heart Institute and other hospitals.
That's in Rabwa.
In Rabwa, right.
Okay.
So we brought him in, we sat down, and I know you're going to introduce him shortly, but sat down and just figured out how do we go doing about it, and how do we prevent a risk or liability on Humanity First organization as such? How do we create an entity that can manage it, in a level that is a professional and professionally run hospital? So then in 2015, Humanity First Healthcare, HF Healthcare Services was born. So
that's a subsidiary of Humanity First USA.
So from that perspective, we continue to grow and build the hospital, and we'll talk about it in a little bit, inaugurated, and that hospital is doing wonderful. I know we will talk about it. I'm coming to the question that you asked why we are here. So in the same breath, this hospital was also an undertaking by Majid Saab. That by that virtue, that HF Healthcare USA was made responsible to build this hospital and operate this hospital. So then Majid Saab invited me that, look, this contract is now with HF USA and Healthcare Services. So why don't we do this telethon from here? Our members get to see it, that what are we doing, what is, and to share with them, all of them, that what Humanity First is doing in terms of the healthcare that we are providing to the highest quality level. So we decided to do this.
So, and just for our viewers who are, again, geographically challenged, Cote d'Ivoire is in West Africa, not far from Ghana. Some people may know Ghana a little bit more.
Right.
About 30 million people. We're near Abidjan, which is not the capital, but a bustling metropolis. It's described as the Manhattan of the West African area. They have lots of culture, 60 languages spoken, a lot of Lebanese individuals. It's a hotbed of activity, and yet they speak French.
Right. Yes.
So how has your experience been here?
I think it's a beautiful experience, and I think from not only from the need perspective, but looking at the country, meeting the people, and the work that Majid Saab has done through the local help here is just amazing. It's just really something that all of our members should view and watch the prior segments that have been broadcasted about this thing. And one thing I'd like to make it clear that HF USA or the people from USA are not directly funding this program here. This is being funded by the people in UK, Canada, and internationally.
And then the design behind that is Hazur Aidallahu Ta'ala bin Nasir Aziz has set up to distribute a lot of the countries to different donor countries. Is that
right?
Just to understand the structure.
Right. So yes, we have made clusters. So we have created a clusters group. So HF USA has about 10 or 11 countries assigned, or we chose to work with them. UK has the same thing, Canada has the same thing, Germany has the same thing. All developing countries are matched with the underdeveloped countries, so we can work as a partner. and we can learn things from them. They can learn things from us and continue. So
Great.
that is the main reason I'm here.
Great, thank you. Jazakallah. And we will go into a healthcare session where we'll be talking to some of these professionals as well. But congratulations on hosting the 13th annual Humanity First USA Telethon, the first telethon from a French-speaking country, although we're presumably speaking in English and it's being translated. We will now conclude this opening session and move to a video.
Hello to everyone that's with us today from International Humanity First Telethon. So we're going to do a tour today, and come with us. Do a little steps. Let's do some steps in the inside, and you can see that we have everything that we need, and the patient can come and select whatever they need, and they are going to receive special attention to if they have any doubts. If they have any doubt, they can ask to our staff, and they are going to help them. Welcome to Nasir Hospital. We welcome you to the 2026 Telethon, International Telethon from Humanity First. Come with me, and we're going to see the inside. This is the outpatient consultation. So we have 11 clinics, and we also have 25 different specialists coming to attend and give the best quality attention to our patients. We have 2 designated clinics that they are just for one single specialist or one single doctor, which is odontology. We have it this way, and we have one for ophthalmology, and we're gonna check inside also. This is our ophthalmology unit, and over here we have all the equipment required to evaluate patients. Not only the ones that are surgical, but also the ones that need medical attention and glasses, etc. So you can check everything that we have. This is a new initiative, so it's Vision Bridge initiative. We are proud to present our Healing Being Optic. We have a lot of different style of glasses. We have for women, we have for men, we have for children, and we have modern styles. We have black if you wish to, and we have also like the classic ones. So you can come, you can choose it. You're gonna have the best attention, and you're also gonna have some amazing advices for you. This is our diagnostic center. We have endoscopy, ultrasounds, we have also x-rays. So we're gonna knock. Hello. The x-ray technicians are gonna be at your service 24 hours, and you're gonna get every other study that you need. This is our lab. We have different areas. We have area of immunology, coagulation, hematology, microbiology. We're so proud to be one of really not so many labs that are level 3, and our goal is someday to become a level 4. We're not such a big hospital, but we have a really good lab, and we're proud of that. This is the ER entrance. We have patients at the moment, so we're not gonna check the inside, but we are gonna do some of the takes when the patients are not there. But we have 4 spaces for attention. We have many doctors attending also on the emergency, not just the GPs, but also the specialists. And you will get attended according to your need. Every day we receive more and more patients. We only have, like I said before, we only have 4 spaces. So we hope that in the future we can have more space to give attention to more patients and a better attention to the ones that we have in the moment. This is our neonatal unit. We have a lot of different equipment required to attend to the newborns, and they will get the attention needed. We have attention from pediatrician and also neonatologist. This is the postpartum area. It's designed for the mommies and their babies, for they to feel welcome and the most comfortable possible. So this is why you see a lot of pink, because the mommies will like pink. This is the inpatient area. We started this area with 4 rooms. Right now we have 12 rooms, and we have a general ward and also the ICU, which is a new area. And it started functioning on 2025. We used to have another area for ICU, but this is a different one. Come check it out. You're checking the expansion of the inpatient area. There are 8 new rooms. We have the presidential suite. Now we're going to the kitchen. Follow me. Hello everyone, good morning. We're going to interview a little bit to the chef. Hi chef.
Hi.
What are you cooking today?
Pues estamos cocinando para 14 pacientes. Estamos preparando un pollo a la plancha, estamos preparando vegetales, puré de papa y pues vamos a preparar también dietas blandas, dietas líquidas, claro, para tolerar.
So we're gonna finish the tour because we have to get ready for a surgery. This is the OR entrance, and we say see you later. We are now going to start our second surgery out of 3. So this is gonna be a total replacement of the hip, and we're gonna have the attention of 2 traumatologists and their team, also nurses and me as an anesthesiologist.
My name is Julio Perez. I'm an orthopedic surgeon. I have been working in Hospital Nasir for almost 5 years. It has been a wonderful experience for me. There's a lot of finest doctors working here, physicians that have been trained around the world. So our practice here is not very common. It's filthy rich in techniques and state-of-the-art procedures.
Desde que nació, me di cuenta de que tenía como que los piecitos torcidos. La verdad que sí fue un proceso largo de casi ya 8 años, pero sí, él no tenía la posibilidad como de caminar, sino solo cuando ya empezó como que a gatear, él se arrastraba. Buscamos ayudas en todos lados y lo operaron varias veces, y hasta que al fin pues encontramos lo que queríamos, ¿verdad? Que él pudo tener una movilidad mejor. El Hospital Nasir nos ayudó en diferentes formas. Una, nos ayudó en tener el especialista para tratar lo que tenía él. Dos, nos ayudó con la cirugía y nos ayudó en los tratamientos de él, del principio hasta ahora, que él está casi que culminando su tratamiento.
Mucho mejor, alegre porque me ayudaron los del Hospital Nasir, muy contentos y mandarles un gran abrazo a ellos porque me apoyaron en lo que pudieron.
Now we are going to go from Hospital Nasir to Chimaltenango. We will drive for an average of 30 to 35 minutes to get there where our satellite clinic is. We are going here.
En Urgencias Nasir tenemos laboratorios, atención de urgencias médicas y consulta externa.
Assalamu alaikum and welcome back to our studio, and I hope you enjoyed that wonderful video of our Nasir Hospital in Guatemala. And I am now with, in addition to Munam Naeem Saab, our chairman of Humanity First USA, we have Majid Khan Saib, who is the chairman of Humanity First International and Humanity First USA, and Dr. Fahim Ahmed Saib, who's a cardiologist in Chicago, but is also the medical director of the Guatemala Nasir Hospital, as well as Humanity First Healthcare International. Majid Khan Saib, this hospital is, we were all there when we saw Hazur Ayyadallahu Ta'ala bin Nasir Aziz inaugurated. It was just such a wonderful personal experience, I'm for sure, for everyone who was there. And since then, how has the performance been? Is the hospital being used? Is it up to your expectations? How is the performance of the hospital, Nasir Hospital?
I would sum it up in, to begin with, in just one sentence. When Hazur is there and he prays for you, it is bound to be reached somewhere.
That's amazing.
So that was our starting point. It was October 2018, 23rd October, and now it has been like 7.5 years now. The performance in many ways has surpassed many expectations. If we look at it professionally, the small hospital like Nasir Hospital, we have been able to do kidney transplant surgeries, which no other Jamaat hospital or Humanity First hospital has ever done.
That's amazing.
If you look at it from the number of patients, that may not be that high, but then the balance of patients who have choices to go anywhere and those patients who we try to help, it is significantly, the ratio is significantly higher.
Can we back up just a second, just for context of everyone? How large is Guatemala? Because in proportion, it seems like there are a lot of patients.
We have it's a country of 16 million people.
Okay, so it's a pretty small country.
Yeah, pretty small country.
And of that, the hospital's been there 7.5 years.
Yes.
You've already performed a kidney transplant. Tell us
exactly.
more.
And then the number of the patients we have been able to tend is 95,000. The patients we have been able to help is more than 20%. 23,000 patients we have been able to help.
What's the difference between the two numbers?
95,000 and 23.
What's the 95,000? Is
the total number of patients.
Okay.
So more than 20% of the patients we have been able to give help of some kind.
Okay.
So that is the ratio between those who pay full and those who are given some kind of discount. And more importantly, they have come from all 21 departments of the country. Each and every department.
Like regions.
Exactly,
okay.
regions.
Okay.
Now, going to the sustainability part. Sustainability is economic sustainability, social sustainability. For humanity first, all three are important. The financial sustainability, because humanity first will not be able to sustain a facility like this if in itself they are not creating enough revenue. So in this case, hospital generates enough revenue to sustain itself. This year, we are actually, we have asked Humanity First USA that we will also try to take care of all the underprivileged patients within the revenue what we generate. Now, when you are reaching that stage, that you are able to generate much more, expectations have gone up, there is a time when you feel that your you are reaching your limits. So you got to improve and develop the facility.
And from what I recall, it wasn't a very large facility, and for 95,000 patients to go through it is extremely impressive. I understand the long hours and a lot of hard work. Dr. Fahim Ahmed Saib, help me understand. There's 16 regions in a country of 16 million people. And I think Majid Khan Saab was right on point that with Hazur Allah Ta'ala bin Nasr Aziz's prayers, I mean, you're on a rocket ship, and you have been. How is the service? How is the medical care going with these 95,000 patients?
I would say this model of healthcare is very unique. The reason it's very unique is the typical healthcare model in these countries is there are doctors' offices and people keep expanding with outpatient services and then look for a major facility that people don't want to own because that is a lot of investment. What we developed is first developed a state-of-the-art hospital as a facility so that when we are ready to open, and we just did one, you saw that in the video, outreach clinics, then no patient is left behind. When in those outreach clinic, if a physician is sitting or a healthcare provider is sitting advanced, and they have been seeing a diabetic for the last 10 years, right? Now the time has come that the kidneys are giving out and they need kidney transplant. They can be transferred to Nasir Hospital.
But what is it known? Is it the quality of our work? Is it the process? Where all 16 regions, Majid Khan Saab said, there's patients coming from.
All 21.
I'm sorry, 21 regions, even more so.
So obviously, a lot of marketing, but marketing out in the community that the might receive, somebody else receives. So it's sitting on a highway where the access is easy, but more importantly, I think our work is speaking for itself. The other thing that's very important in healthcare, and all of us need healthcare from time to time, is we are now attracting very high quality doctors in the area who choose to practice in our hospital. And when the physicians that are specialized in your field choose to come to those patients will follow.
That's amazing. That is amazing. Munib Saab, you were at this inauguration as well. Any reflections on this journey really quickly?
I 100% agree. The growth that I've seen, the quality of the care that they have provided, and the compliments. And I think they got some social media also rated them to be one of the highest quality.
If you Google Nasir Hospital, it is one of the highest rated in customer service in the whole region.
That's great. That's
in the whole of Central America.
Quality matters.
Not only in the country.
Wow. And I know you have patients from outside of Guatemala as well.
Yes.
And I know we only have a minute left, but Majid Saab, that's incredible work. But yet, it seemed like the facility is bursting at the seams with 95,000 people. What have you done to develop and to be able to serve more people?
Right. So in the last 2 years, a major, we have been able to develop the hospital on so many fronts. First of all, we inaugurated the new inpatient block. And for all the viewers in USA, it was named after Dr. Ihsanullah Zafar Saab. Very emotional for me personally.
Former Amir Saab USA.
And the first chairman of Humanity First USA.
Oh, I see.
So yes, Hazur named that. So yes, Hazur actually approved it. So the next is that we opened our satellite clinic. We did pharma care. There's a new external facing pharmacy we opened, and we did just in December we inaugurated the new intensive care unit. Now, by adding the capacity build, like new rooms and intensive
How much
care,
space have you added in terms of, I don't know, size?
I would say that the total, and of course, some of things I did not mention is a training room, etc. So more than 6,000 square feet of area has been added. And sorry, that could be a little more, between square meters and square feet.
Yeah, the math is.
Yes. So, yes, that area has been added. The facilities we started with 6 basic specialties. We have reached 25.
Wow. So that's expanded significantly, serving all.
Exactly.
That's amazing. Exactly. We'll come back to learn more about the hospital. We'll come back to learn more about Humanity First Healthcare International and USA as well. But right now, if you'd watched the video, one of the things that happens at Nasir Hospital is gift of sight. They actually have a full clinic for the eyes, and as well as getting glasses and treating glaucoma and other things for that. We're going to watch a short video on gift of sight before we come back.
again and again and again. Thank you very much, ladies and gentlemen.
Estoy bien, estoy de 95, 100%. Ahí estamos. Gracias a Dios, que más que todo, a Dios doy las gracias y también los personales de esta instalación.
Estoy encantada porque de verdad los de la Universidad de Loyola del extranjero, muy buenas personas, excelentes médicos, el trato humano de verdad que es excelente. Yo estoy muy contenta porque sí, ellos son muy amables, son muy delicados al momento de tratar a las personas, ¿verdad? Yo estuve ahí, casi que me tocó pasar de último, pero son muy, muy lindos todos, de verdad. También el personal del hospital, el equipo de enfermería, todos muy amables, muy atentos, ahí muy especiales, de verdad.
Assalamu alaikum and welcome back. We're going to be, in this segment, we're going to be talking about three things. Our Vision 2033, which is 10 years from now, or a little less than 10 years from now, what the world looks like. We're going to be talking about our Vision Bridge program, as well as the hospital in Tanzania. I'm here with Munam Naeem Saib, who is the chairman of Humanity First USA, Majid Khan Saib, who is the CEO of Humanity First International and Humanity First Healthcare International and Humanity First Healthcare USA, which is a subsidiary of Humanity First USA. He is the CEO. And Dr. Fahim Ahmed, who is not only a cardiologist, but also a medical director for not only the Nasir Hospital, but for Humanity First Healthcare International. Welcome to all of you. Majid Khan Saab, let's come back to you. Help me understand this program of Vision Bridge. I never, we don't talk about the eyes. Look into my eyes. I mean, there's a lot of romantic notions of that. But how does that? What are the challenges there?
So, many years ago, Humanity First started with Gift of Sight, an extremely useful program, and they've helped thousands of people restoring their eyesight. Excellent program. But with HF Healthcare, we try to find more sustainability into every initiative. So HF Healthcare and Loyola University Chicago,
Dr. Bouchard,
Dr. Bouchard, we joined hands and we started this, launched this initiative called Vision Bridge. The vision which has a bridge between sustainability and whatever we are offering now.
Incredible. I know Dr. Bouchard has been to many events, and Dr. Hassan Khan, and Dr. Tayyib, there's many doctors who are working.
Dr. Hassan Khan is one of the pioneers of Gift of Sight. So now this Vision Bridge revolves around the idea that anyone who wants to help with the going on a mission, first of all, that person must become a member of Vision Bridge by paying a certain amount of membership fee. Now that means that it becomes more exclusive. And this Vision Bridge team, which will have physicians, which is going to have residents, which will have industry partners, donors, administrators, IT people, they would become members, and what they will do, develop ophthalmology at Nasir Hospital, develop ophthalmology in Ivory Coast, Cote d'Ivoire, and then have our first Vision Bridge, which we will talk later, in Tanzania. So this is a form of, and they will take ownership.
So help me understand. So Vision, let me see if I understand it.
Yes.
Vision Bridge is an initiative with Loyola University and Dr. Bouchard, big university in the Chicago area of the United States of America, and Humanity First Healthcare coming together to build the sustainability of helping people around the world through a funding model that is sustainable for those that receive the services?
Right. Also, these people who will be receiving surgeries will not be totally free. They will be done at HF Healthcare facilities, wherever we have that, so that the after surgery care is given.
Yeah.
And the patient will give a certain amount, a smaller amount of fee for getting a world-class surgery by the patient. So what happens typically, what we are doing at Nasir Hospital, we start bringing in patients 3 months before the mission arrives, doing all the screening, evaluating, test. We get them ready. After the mission leaves, we take care of them a month later. So it is a full process, full follow-up for the patient, starting from when he first arrives at Nasir Hospital till a month or 2 months later, till the time he needs help.
So this is really interesting, Dr. Fahim Ahmed. I know there's a lot of medical challenges in the USA with healthcare and how do you receive quality healthcare, insurance issues. This seems like a model that for me, as well as anyone in need, because I can pay into it, receive the services at one of the many locations with a worldwide network. And is the quality there, or should I be afraid that there's a trick here?
So one of the biggest challenges in medicine is what is called variation in care.
Variation in care.
And variation in care is something where people in Guatemala may get the same cataract surgery differently done than another hospital, and they will do it their own way. With Humanity First Healthcare, getting this model, we're going to do it in proven pathway-driven healthcare. These physicians who buy into our vision, they're going to be led by Professor Bouchard and others who are leaders in their field.
He's a world-class leader.
And they're going
right?
to say, this is how we're going to provide care. And I think that is the model we're going to bring ultimately everywhere. And the Humanity First Healthcare product, like under the guidance of Khalifatul Masih, is going to be something that people are going to look into. If I'm diabetic and I go to a Humanity First clinic, I can rest assured that that same care will be duplicated if I end up in Guatemala.
That is
They'll
incredible.
follow the same guidelines, same protocols.
And Munib Saab, this seems like a vision for Humanity First, where sometimes there's a term called donor fatigue. Every year I give, what problem do I solve? Right, you know, it never goes away. It seems like the Humanity First team, which I'm proud to be a part of, is really thinking about how do we make this sustainable? How do we make the funding sustainable? So if I was to donate $1 today, it's being leveraged to create value, to make it self-sustaining, so we can provide more products in the future. Is that the vision here?
Absolutely, and I think need is there. Whether you look in South America, or you need in East Africa or West Africa, the need is so much that you have patients lined up to do the surgeries. And we've been doing it in traditional ways, just raising $150 and going out and spending it. Using the local doctors, that is good, because that's basically you're providing a very bare minimum basic care. But sustainability and the quality of care are the two major role that this Vision Bridge is going to play. You have a hospital backing you up. And then, from sustainability perspective, you are obviously going to invest once, and then you will continue to reap the benefit. You'll charge money to the patients who can afford. Then you have money for the other ones that you cannot afford. You can balance it
real quickly.
Yes. There is one more thing here that I mentioned: industry partners. So we would like industry partners, which we are already reaching out. If they become partnered at this, then the equipment and other things also gets donated. So if we are able to create world-class ophthalmology centers in 3 places to start with, and then later on improve, then the true sustainability can be achieved, because the mission itself is self-funded.
This is incredible, and inshallah, as you develop this model, you've got world-class leaders like Dr. Bouchard in the space, you've got funding models, you've got these things happening. Let me change the topic for a second because we're running low on time. There's also, this is geographically challenging me, that's why I need to look at the map back here, but there is another country in Africa, Tanzania, that is a member of the Humanity First group of countries that Humanity First USA is supporting. What are you thinking about doing there?
Yeah, I think Majid Saab and myself, we both visited there. There has been a plan to open up a medical care facility for a period of time. Actually, we visited, we sat down with the government, medical department, and asked them, what are your needs? They wanted us to invest in the infrastructure. They wanted us to do not just go pop another pop-up clinic, but do something that can be a part of infrastructure. These things cost money. You cannot do a whole lot of number. But out of those things, eye care, that was the top shortlisted hospital that we came up with.
So you're thinking about a hospital in Tanzania next after Cote d'Ivoire. Let me switch. I know we have a minute left here. Majid Khan Saab, what is this Vision 2033?
So before I go there, let me put something about Tanzania.
Really quickly.
Yes. Just before we started this conversation, I received a text from an ophthalmologist from Cook County Hospital in Chicago.
Right.
She is the 8th ophthalmologist who signed up for Vision Bridge.
That's amazing. That's amazing. Okay, Vision 2033.
Yes.
Yeah.
So Vision
That's incredible.
2030. That's
30,
I think,
excuse me.
Yes. Vision
2030.
Yes. So, as we talked about, that Nasir Hospital is reaching its optimum, and we need to develop more. It is still a Class B hospital. And so we are planning a state-of-the-art diagnostic center there. There's no CT scan, there is no mammography, so we need to add those facilities. As we have a sustainable, model, so we will be talking to the banks, we will be talking to the donors, and so the next step is this year we are putting up a dialysis center. We are also starting with the diagnostic center. Remember, next year we will be entering into our 10th year. So we would like to have this diagnostic center inaugurated within that. Now, having said that, Tanzania is one of the places we are planning an eye hospital, and after Hazur's guidance and approval, we will be launching it soon.
That's great.
Yes.
That's great. I know we're out of time, but we'll come back to this conversation as well. And what I really appreciate about this is, in my work in Center Tijarat, it seems like there's a lot of AMDs who can donate or invest in these initiatives as well, and you've structured it in a way where it can work, which is brilliant. Next we are going to roll over. I know. Over to a video about doctors at Vision Bridge, and then we'll come back and talk and continue our conversation.
Hi, everyone. My name is Dr. Zubair Ansari from Miami, Florida at the University of Miami Bascom Palmer Eye Institute. Part of my mission has been to work with many different organizations globally. And we're currently here in Guatemala and at Hospital Nasir with Vision Bridge. And I can confidently tell you that the philanthropy and the operation here is fantastic. One of the best I've ever been to.
Hello, my name is Paula Dmitriev. I'm a clinical assistant professor of ophthalmology in the subspecialty of cornea at University of Michigan. The new initiative that we'll be talking more about is something called Vision Bridge. And the idea in Vision Bridge is a world where visiting ophthalmologists are no longer necessary. By building infrastructure there on the ground in communities all around the world, we're able to take out this idea of mission trips altogether and instead focus on allowing local providers get the training and the expertise to be able to take care of their patients and help in their communities.
Vision Bridge goal would be to provide equitable eye care for all. And that fits in importantly with our philosophy and principles of humanity first healthcare to provide these needed services to those who will benefit from.
Welcome back to the Humanity First USA Telethon. As we come back and as we discuss all the work that has gone into the healthcare initiatives under Humanity First Healthcare International and Humanity First Healthcare USA, you see that there are many things happening, from hospitals to innovative funding models to sustainability. In this concluding session of talking about healthcare, before we go to other areas, the concept, this vision bridge. We just saw Dr. Bouchard on the screen as well. This is and in my work in Sanat Tijarat, we look at how do we support in a sustainable way, and how can we invest in a sustainable way. This seems like a great opportunity for someone in the US to say, I'd like to donate some money and invest some money. Is that possible?
Yes, it is quite possible. Actually, by creating a membership-based Vision Bridge program, what was achieved? Last week, we were having a conference call, and one of the ophthalmologists who have joined Vision Bridge, she said, what is the status of our hospital in Tanzania? Our hospital. So that is how they take ownership.
People are really
ownership.
loving it.
So
and this is just the not the vision, but the vision, the eye part. Okay.
Exactly.
Okay.
So that is how you know, bringing people, bringing other organizations, as you said, Sanatu Tijarat, if they are, and of course the industry partners, even anyone who is ready to become, but that person needs to become a member. Like Humanity First, in Humanity First, you don't need to be a member. You just donate whenever you want to.
So help me understand, what does it mean to become a member? If I become a member, I pay a certain monthly fee.
Yes, a yearly fee.
A yearly fee,
Yes.
and in return, I can receive my vision services from you?
No.
Okay, I just want to make sure I understand.
No. What I mean to say is that you become part of the team, that you feel that this initiative is worth becoming a member of. So you can proudly say, I'm a Vision Bridge member, and with a, you know, with a pin. And then of course you are becoming a member of a world level initiative. Wherever we have a facility available to develop, these visionaries of Vision Bridge will help put together the resources.
So this is still a donor initiative.
Yes.
What is the banking and how you grow forward in terms of investing as well? You had mentioned earlier.
So as Monam Saab mentioned, the first role model of Vision Bridge hospital would be Tanzania Hospital. So we expect that it to become a center of excellence for academics for whole of East Africa. So what will happen is that these people who are so motivated that they are bringing their hospitals, they're bringing their universities, they're bringing their resources, not only to help, but also very important to transfer the skill set. That is very important, because any sustainability without transferring the skill set is not going to be really sustainable. So all of them are coming together with a single mission, that global ophthalmology model has changed. It no more is just giving cataract surgeries.
And Dr. Fahim, this Vision Bridge, as a physician, does it make sense to you?
Absolutely. So, you know, we, and as physicians, will belong to multiple societies. And within those societies, then there are sub-memberships of your interest. For example, if I'm a member of American College of Cardiology, and then I have interest in education, American College of Cardiology will have education. So these ophthalmologists, who are all very qualified members of American College of Ophthalmology, whatnot, they want to volunteer their time to Humanity First. They're buying a membership in that organization. What we get in return is that these physicians and these providers are committed to the vision that Majid Khan Sahab has, Humanity First has, and we now have a very dedicated team. The door is not open for everybody, right? The door is open to people who are very committed to the way we want to deliver healthcare. And that's the vision we have, right? And then the same thing with industry partners. If they want to partner with us, Humanity First has certain goals that we're going to do. Make a state-of-the-art hospital in Tanzania for eye care, and this is how we are going to do it. He's not going to tell us how to do eye surgery, right? Majid Sahab is an administrator. But this group of physicians who are committed now are going to make that vision for us that Humanity First carries. So they're part and parcel of the Humanity First family because they're committed not only dollars to it, they're part of it.
Right? That's brilliant. Madam Saad, let me try to start from the beginning and see where we're at. You talked about 2015. You talked about Nasir Hospital and building that, and Majid Khan Sahab literally operationally building that hospital and adding a second wing. You talked about Humanity First USA having the expertise in hospital and where we learned hospitality in a hospital as well, right, and building that out and done an incredible job. And Humanity First Healthcare USA is supporting this in Cote d'Ivoire. Now looking forward in the healthcare space only, Madam Saab, so you have a project in Tanzania. Right. How do you see this growing in terms of healthcare going forward, and our donors to think about healthcare versus all the other priorities?
Right. I think, first of all, the 2030 vision that Majid Sahab shared, that is still an open item that we still need to fund and take care of that. So whether that's expansion of Nasir Hospital, Guatemala, or this hospital that Ivory Coast that is being worked, and that Tanzania is our next. That could be, sustainability is our top priority right now. And that will only come if you provide quality care, and if you are, you mentioned that the care that you will provide to the people. So that's what you're building up. Opportunities for in overall in Humanity First from a sustainability perspective is that where people can trust you, people can come and kind of invest with you also. I think that is most important thing here.
What does that look like?
Okay, so there could be investment of your time. There could be even investment of your money, where there is a donation portion of that, and there is you actually invest in a program where you will get your return back. You know that it is being used to benefit the mankind, yet you may get something out of that also. So there are different type of people. People will just give you simple donation. People will give you simple time, but there will be people who give you funds as long as it is given to a trusted organization that where you can return them back. So we have to expand our portfolio. We need the funds. So 2-3 different ways.
But you need funding for construction of hospitals.
Right.
You need funding for operations, and you need sustainable funding for these 26 departments within a hospital and growing those, and clinics as well. Right. But the magic here, as I understand it, and you tell me, is that as we build each of these units, we're making them self-funded, self-sustainable.
Right.
So it's not, my dollar goes to build a hospital, and it's self-sustaining, and it hopefully gives off money for the future hospitals as well, and helping people and having financial sustainability.
And Matt, we will continue to do some really the desperate charitable need projects. But if you teach man how to fish, and also take care of that portion, and then also in your own projects create sustainability. So we have to come from all three angles. We have to balance it.
Dr. Fahim, as you think about this vision for the future, how do you make sure, typically, the construction is great because there's a finite time, it finishes, and hopefully it's a good job and it doesn't collapse or any of those issues. But managing people around the world at a quality that we can be proud of is really hard, no matter what industry you work in. I mean, you've got a tough job on your hands to achieve all this. How are you thinking about this work?
So healthcare is very unique because there's a lot of technicalities that an administrator can be tricked by the physicians, right? And that's where the role of the medical director comes in. So in my organization, I get requests for equipment all the time. Everybody wants the new and shiny new machine, right? And he's pushed about. Then it's our job to look at it. What is something that is actually going to be helpful and impactful for our patients? And I think the question that how do we maintain that quality and the whole thing is ultimately to set up systems within the healthcare system that corrects. And one thing we really realized that a medical error, even in the best of hospitals, happened, but the lives get saved because they get recognized. So you can have the best surgeon in the hospital, and he operates and does an appendectomy, and the patient goes to the room. The surgeon has left. You have a window when that patient is deteriorating, that 30 minutes, 40 minutes. If somebody will not pick that up at that moment, you will, even though the surgeon did a great surgery, you'll have a bad outcome. So in these huge centers, big centers that operate very, very well, is to recognize that window of opportunity when the patient can be saved. So in my opinion, I think for us, it is very important to maintain a dyad leadership, because a leadership that realizes and can speak the language of the doctors, a medical leadership, and then an administrative leadership, because as we grow, ultimately you will have to have a dyad.
That's incredible.
Yeah.
Majid Saab, since you're the CEO of Humanity First Healthcare USA, speak to our donors or investors that are listening to this. Tell us one more time why the value of investing in Humanity First Healthcare.
So when somebody donates to a healthcare facility, we as our part of our faith, that is, it is Sadqa Jariya. And in whatever way you donate, whether you're donating it for equipment, for building, or to helping out a patient, till the time that thing is useful for someone, that Sadqa Jariya continues. So this is one of the best ways either to help yourself or do it in the memory of your loved ones. One of the programs which we are which we have already started is to taking care of a project or part of the funding through your families. So you do it in the name of your father or grandfather, and even after you have passed away, your children can take over that, and their children can take over that. So it could be some sort of a family bonding with Humanity First, with their family for the rest of the time. So this kind of Sadqa Jariya, which the families come together to help and be with it for generations
some
to come.
disturbing images.
Generations become part of this noble initiative.
Thank you to all three of you. This has been a segment of Humanity First USA, is Humanity First Healthcare Division. Transition to a 30th anniversary video and then come back and learn about all the other wonderful initiatives of Humanity First USA.
The following report contains some disturbing images. The following report contains some disturbing images. The following report contains some disturbing images.
30 years ago, a vision was born. A vision of service, kindness, and above all, humanity. It was the vision of Hazrat Mirza Tahir Ahmed, founder of Humanity First.
बैनुल-अक़वामी खिदमत-ए-खल्क़ का इदारा कायम करना चाहिए और उस इदारे का दायरा-ए-कार तमाम बनी नौ इंसान तक आम होगा और उसमें सिर्फ एमएलयू से चंदा नहीं लिया जाएगा बल्कि शरीफुल नफ्स दुनिया के किसी भी इंसान से जो इस इदारे में शामिल होकर खिदमत करना चाहता हो उसको भी खिदमत का मौका दिया जाएगा। अल्लाह ताला इसकी तौफीक अता फरमाए।
He envisioned an organization that would transcend borders, races and religions in order to serve those in need simply because they are human. Thus, Humanity First was created, a global relief organization dedicated to alleviating human suffering. What began as a response to the Bosnian crisis has now become an international movement for good, with branches in over 65 countries. Through every disaster, every crisis, Humanity First has been there, wiping the tears of the distressed, holding the hands of the vulnerable, offering hope where there was none. Under the continued guidance of Hazrat Mirza Masroor Ahmed, Khalifatul Masih V, this mission of selfless service carries on to this day.
Thus, to love Allah's creation is something truly great and deeply appreciated by Allah the Almighty. Hence, it is up to the members of Humanity First to strive earnestly seeking the betterment and well-being of mankind. Never rest easy or feel satisfied with what has gone in the past. Rather, look to the future and see how and where you can increase the scope of your service for humanity. It should always be your objective to provide the maximum possible service whilst utilizing the minimum possible resources.
From war-torn Gaza to the flood-ravaged lands of East Africa, Humanity First has responded to over 280 disasters in 111 countries, assisting nearly 3 million victims. Trained teams work alongside the UN, delivering medical aid, emergency shelter, food and water, bringing immediate relief in times of greatest despair. Half the world's population lacks access to basic healthcare. Humanity First is changing that. With hospitals in Guatemala, Senegal and the Ivory Coast, clinics in Mali and Indonesia, and mobile clinics reaching rural villages, Humanity First has provided medical care to over 900,000 patients. Clean drinking water is still a dream. But through solar-powered boreholes and thousands of water pumps, Humanity First has brought safe water to over 6 million people. Education is the key to breaking the cycle of poverty. Humanity First has built 100 schools, giving rural children a chance at a better future. With over 56 vocational training centres in over 30 countries, more than 70,000 graduates have gained the skills to transform their lives. The most vulnerable among us are orphans. Humanity First has therefore provided food, education and shelter to thousands, with orphanages in Benin and Indonesia, and new facilities opening in Uganda and Sao Tome. From food banks in Europe and North America to sustainable farming projects in Africa, Humanity First is fighting hunger. Over 700 million people worldwide face chronic hunger. Humanity First has distributed more than 6 million meals in the last decade alone. Moreover, through Qurbani meat distribution, Humanity First has fed nearly 5 million people, ensuring that families in the most remote regions receive vital nourishment. In Canada, the USA, and the UK, Humanity First food banks provide thousands of meals every week to struggling families. For the homeless, the elderly, and the forgotten, Humanity First is not just a charity. It is a lifeline, a source of dignity, and a symbol of compassion. Healthcare is a fundamental human right, yet billions lack access to even basic medical services. Established in 2017, Humanity First Healthcare is a subsidiary of Humanity First, incorporated to build and manage healthcare facilities. With a mission to provide affordable, quality healthcare, HF Healthcare has served over 75,000 patients and performed more than 1,000 surgeries. More importantly, 17,000 patients were helped financially. Facilities like the Nasir Hospital in Guatemala, a self-sustaining facility, operate 24/7, offering emergency and surgical obstetrical care. Staffed by local professionals collaborating with over 400 international volunteer physicians, HF Healthcare ensures that even the most undeserved receive the care they deserve. Another addition to the network of hospitals is the Masroor Centre for Healthcare in the Ivory Coast, which is set to make a real difference not just for the people of Ivory Coast, but for communities across West Africa. With this initiative, HF Healthcare is taking a significant step toward improving lives and strengthening healthcare in the region. The Masroor Centre for Healthcare in the Ivory Coast is more than just a hospital. It is a beacon of hope. This organisation is not just for those in need, but also for those with the heart to help. HF brings together selfless individuals who want to give their time, resources, and love to make a difference. To our incredible donors, we want to say, every life you touch, every meal you provide, every child you help empower, and every family you uplift is a reflection of your boundless compassion, unwavering kindness, and deep commitment to the betterment of humanity. You are the reason hope exists, and your impact will resonate for generations to come. From just a dream to a worldwide movement, Humanity First has touched 17 million lives. But the journey does not end here. As we mark 30 years of service, we look ahead with renewed determination to reach further, to serve more, and to put humanity first.
Assalamu alaikum and welcome back to Humanity First USA's telethon as we shoot from a new and unique location of Côte d'Ivoire. I'm here with Munam Naeem Saab, the chairman of Humanity First USA, who has been leading Humanity First in this position for over 20 years now. 22 years, mashallah. Munam Saab, I want to go a little personal before we go into the big conversations. I recently attended with you the Humanity First International meeting in the UK, where Hazrat Akhtas spoke, and we'll talk about the great and incredible guidance point by point. How was that journey for you? It's been 23 years, 22 years of this work. Sometimes we get exhausted. Sometimes we lose sight of the big picture. How's it going for you?
Right. I think I'll just tell you a little bit story. When I was leaving, I was under kind of an enormous pressure, feeling very concerned. If you had seen since 2025, our economic situation in our country have been declining.
Yes.
Our donations were dropped by 25% in 2025. And, so it was just a huge concern. We had so many programs running. Some of the programs are not self-sustaining. So if I'm running 37 schools, there is X amount of funding you need. If you're running orphan care, you list it, and fundings were not coming in. And here we were sitting doing the math. Do we need to close any of these projects? It was really hurting me inside that how can we close these projects? I was begging out there.
Because donations were down, the work was increasing,
Right.
which typically happens in a
So
downturn.
I really just praying and praying and praying. So I thought that since this conference is being held, after the conference, I will meet with Azur and, tell him the situation and make that request. So we attended the conference, and then you all know Azur's address, and I think we should talk about it a little bit more. But, after the address, I had a mulaqat with Azur, and I said, Azur, when I was coming here, this was my situation. But after listening to your profound guidance has given me so much energy that I just can't wait to get back and, try to do something about that. I was thinking that was not going to be possible. And that's exactly what we did, although we are still in that, declining terms. But I went out and we went to different cities. And I talked to all the membership where we met. We went to Dallas, we went to Houston, we went to Detroit.
From what I understand, you did small group dinners, speaking to donors, sharing the story. How was that experience for you?
I think that was wonderful because people understood what Humanity First do one-on-one basis, right? A lot of people don't read emails. A lot of people don't read social media. Once the story touched, once they knew, if we don't step up and do the responsibility that we have, perhaps one school is going to be closed or one food pantry is going to. When we started to tell that story, I was just surprised to see what we were able to raise from Houston and then subsequently. So I think that was the main thing, is smaller dinner, and it didn't cost us as such to Humanity
Putting
First.
on large events, it becomes an event in itself.
Right. People paid for the dinner at their home, breakfast at their home, invited their friends. And, they came and they listened.
That's great.
And it was not so.
That event in that speech, I remember Hazur Aidallahu Ta'ala bin Nasir Aziz's first Humanity First International event, the speech there, and then now this one. And I think what we all did was we broke down that speech into line by line to understand the guidance.
Right.
And from what I understand, I'm looking at the guidance, so I'm cheating a little bit, but
Yeah.
Hazur shared the promised Messiah's vision and to help people, and the Holy Prophet Muhammad sallallahu alaihi wasallam's vision for helping people, and he really broke that down. Can you share a little bit about how he did that?
Right. I think, so this speech was taken, it was 130 some odd points that you extracted. First, 1 through 30 points. He reminded every single person of the community that what is purpose of your creation, what is the mission of Promised Messiah, why we must serve. So it was just Hazur telling everybody that you must do the work.
And I didn't realize the Promised Messiah was sent to uphold the principle of serving mankind selflessly.
Right.
I mean, that's such, in one sentence, it captures the mission.
Right, absolutely. And, so I think, and there are so many profound statements. If you start to read every single one of them, it basically, motivates you that, what am I doing? I've signed this path and here is the situation. So you just,
And then how do we alleviate human suffering? How is humanity, Humanity First is a vessel to be able to alleviate human suffering, as Azur guided every Ahmadi to do.
Right. And so Azur not only obviously, encouraged that we are supposed to do that, he gave us a framework. How do you do that? What level of compassion and care you need to put in, your attitude, your, the way you should be treating people just as you are treating yourself,
and not to garner recognition and praise and all this. Too many places where it feels like it's for the donor or his name versus the actual work.
Absolutely. I think, so I just, and with guidance to the people And then I think in this whole thing, Mac, if you raise that, he praised Humanity First, of all the volunteers that work in Humanity First. But at the end of all that praise, he made another statement that, again, that's what keeps us doing better and better. So, after like maybe 10 or 20 points where Azur mentioned that how Humanity First volunteers are serving out there and what, not the recognition, but the feeling of the people are when we do the work. But he said at the 45th point was, always remember that your every success flows directly from the boundless grace of Almighty Allah. That this is not something that we should get a chip on our shoulder and then we said, oh, we are doing it, and we should be. This is the mercy and grace of Allah on us to do the work, and I think that basically.
So even having the opportunity to do this work is the grace of Allah.
Absolutely, yes.
That's incredible.
Yeah.
That's incredible. And as we go through these points,
right?
What is the work that Azur is telling us to do going forward? Is it to continue to build as we have more large hospitals, more clinics, more? How does the work come?
Right. So I think Azur wants us to be very frugal in terms of the money that we raise. People who are giving their single dollar, how to spend it, right? So yes, I think there was Azur's guidance that there is only so many big hospitals we can build. And as you said that you can do that, and that basically helps the infrastructure of the country and all that. But from funding perspective, it is very difficult. We are not a large grant organization. So Azur gave us a couple of solutions. Azur said, first, the bigger hospital that you have built, make that a hub of center of excellence, and build the smaller clinics around it. If there is a clinic that exists, help them, support them, bring the people there.
Model,
right. Or if there are none, then build the clinics around. And then also another solution is that wherever the need is, build smaller clinics. One day it'll be enough that now you can build a hospital to feed the need out there. So that was one clear guidance, that there is so much you can do from the bigger hospitals. So that's why we are very careful in terms of what is our next bigger project.
And as we also talked about how Humanity First is really working within the Jamaat as well. We can raise money. We support everyone, and we can raise money from non-Jamaat members. The Jamaat doesn't do that. Now the Jamaat and the Muslim community has hospitals as well. Right. But are we interconnected in some way? How does that work?
I think that to me was very crucial, very critical to clarify to the members of community that that we are part of the Jamaat because we are initiated from the Ahmadiyya Muslim community, and the value of serving comes from our faith. So from that perspective, that the so-called the separation is from technical perspective, that we are separately registered, board is separate there, but our true values come from our faith of serving, right? But then he guided the members that you must participate in the work of Humanity First also. It's just not only just give your regular sadaqah and other charitable work that you do on personal basis, but this is a charity that has been created to add on to the work of the Jamaat that it does already. To further the work of Jamaat, Humanity First is created. So I think that he guided the members, and therefore I think all the departments of Jamaat are very engaged in working together. And we'll have I think another session.
We'll talk about how we interconnect with the initiatives of the Muslim Community USA and Humanity First USA, and there's lots of examples of that as Azur has guided, that we're not two alien organizations.
Absolutely.
We're all under Khalifatul Masih.
Then I think another point that he gave us, he said, this is the growth that you had in 30 years. But now you're going to have, I forget the word, but enormous growth.
Exponential,
Exponential was the word. And we were all sitting, we had meetings after that Azur has mentioned this exponential growth. What does it mean? And so it means that what you did in last 30 years, the next couple of years, you'll do that much work.
And one of the things that one of the many things that touched my heart in that speech
Right.
was when Hazur mentioned Gaza and how Hazur took personal interest in working with the members of Humanity First team in
Right.
Gaza and communicating with them and those individuals doing the work. I mean, I think it touched all of our hearts where we think we did a little bit of work and perhaps we look for recognition or not, but these are individuals that have nothing.
Right.
And they're serving each other.
That, the courage of those people, yes, Hazur, again, I think if you talk to Dr. Aziz there, that, Hazur gets so much continuous update of those people, how they're feeling, and those people are so brave helping their, people in need over there. So Humanity First is involved, and from USA, Germany, Canada, everybody is working together with Humanity First UK to help that. But Hazur highlighted what devastation that the people in Gaza were going through.
And the UN and other charities have recognized the work that Humanity First has done in Gaza as well. Also recognize the women of the Jamaat and their work with Humanity First. As it was said regarding Humanity First UK, the ladies team is working with great dedication and passion.
This is very interesting. Specific guidance that ladies, don't be shy back, and you need to. First of all, I think within our organization there are many departments that are run by ladies. All the way. Where we were lacking is the disaster response. Yes, medical doctors, the female lady doctors were part of engage that. But I think, that Hazur, basically pointed out the gap there. There was a meeting with the, in UK with the Lajna group, and Hazur gave them the guidance. So now we are working on giving training to Lajna to be at the forefront of the disaster response.
So women can work on Humanity First, a disaster relief work.
Exactly, not only on the medical side, but also on the non-medical side.
That's
not
great.
only on disaster response, but disaster preparedness, disaster readiness. And we are doing camps, which is post-disaster survival. God forbid something major happens. How do you survive? If you don't have the water, if you didn't have the food, what would you do? And so there are courses being developed through the webinar that we're going to teach, but we are doing the camps also with collaboration from the Jamaat perspective. We are teaching men, women, all together that, how you're going to respond to a disaster. What do you need to provision yourself at home? God forbid some disaster hit.
And for Humanity First USA, I know I ordered a few kits. You have made it very easy for us to get a backpack with a kit, so we have in our home. No MD should just reach out to the website Humanity First USA and order their kit. There's no excuse not to. And then this training, and I know you're leading some trainings as well. The quote I found of Hazur was that at once the Humanity First budget was in the thousands. Now it's in the millions, and it will be in the billions. A few of us can't even fathom those numbers, but Hazur has now laid out the vision. We were just talking earlier. Once Khalifatul Masih says it, it's just a rocket ship heading that direction.
And it lines up with the vision of Hazrat Dr. Masih Rabi that one day you'll be bigger than Red Cross, right? And when Hazur made that statement that it will be in billion, and Majid Sahab earlier mentioned another program there that if a project is given to us by Hazur, is blessed. And it will happen. So now, what do we need to do? He's laid out that vision. We need. So we are, working on one thing before we switch topic. There is that the point of this disaster preparedness and disaster response readiness that we are created to help. We are here to help. From Humanity First perspective. So if you are not ready yourself, then how are you going to help other people? At the time of disaster, if you're not prepared, you're not trained, you don't have supplies, you don't have things, you are not going to help anybody. You're just
That's absolutely
so
right.
I think that is the main purpose, to get everybody ready.
And today is also in some parts of the world we celebrate Mother's Day, and I love the Hazur's quote about the women being involved here as well and taking care of our mothers. So happy Mother's Day to all those whose mothers are here and those who have left us as well. And with that, we're going to transition to an overview video of Humanity First USA, and then come back for another session.
ensuring children and youth have access the Humanity First Student Division. Thousands of students learn foundational academics or career skills each year through the Humanity First Knowledge for Life program. We build and operate schools that provide a high-quality education and empower them to succeed in life, support their families, and strengthen their communities for the future. Food security affects families everywhere, including here in the United States. Humanity First USA responds through regular food distributions in multiple cities and a full-service community pantry in Duluth, Georgia, made possible by dedicated volunteers, schools, businesses, and local partners. Our goal is simple: to make nutritious food reliably available to anyone who needs it. Through the Humanity First Food Security Program, this commitment extends worldwide to millions of people served globally, bringing relief, dignity, and stability to communities facing hunger. Access to clean drinking water remains one of the most urgent global challenges. Through the Water for Life program, Humanity First installs hand pumps, boreholes, and sustainable water systems in communities facing severe water scarcity, bringing safe water closer to homes, schools, and clinics. These efforts help reduce waterborne disease, support education, and ease the daily burden on families who once traveled long distances for water. Globally, more than 6 million people have gained reliable access to clean, safe drinking water and the opportunity to build healthier, more stable futures. Healthcare should never be out of reach. Yet for millions of people around the world, it still is. In many low-income countries, life expectancy is nearly 18 years shorter than in wealthier nations, simply because access to care is limited or unaffordable. Humanity First USA works to close that gap through a comprehensive approach to global health. We build and support hospitals so communities have long-term access to quality care. In Guatemala, Nasir Hospital provides high-quality, affordable medical care for thousands of patients each year. With expanding facilities and new outreach clinics, the hospital is becoming a regional center of care for families who have long gone without reliable health services. In our partner countries, local teams run mobile medical clinics to bring doctors, screenings, and treatment even closer to patients where they live. Our international medical missions unite specialists from around the world to treat patients who might otherwise go without care. These combined efforts have restored health, dignity, and hope to almost 900,000 patients who need it most. For many people around the world, losing their sight means losing independence, opportunity, and connection to daily life. Treatable eye conditions continue to go unaddressed simply because care isn't accessible. Humanity First is working to change that through the Gift of Sight program, bringing eye care, screenings, and life-changing surgeries to those who need it most. We partner with local hospitals and international specialists to provide sight-restoring cataract surgeries and other treatment. We also deliver essential equipment and training so care can continue long after each mission ends. Because when sight is restored, so is dignity, mobility, and hope. Tens of thousands of people now see their families, their work, and their futures more clearly again. Children who are orphaned have already faced unimaginable loss at a very young age. Humanity First USA works to give them the stability and care they need to move forward with hope. At our orphan care homes, children receive safe shelter, nutritious meals, health care, education, and a nurturing environment where they can grow, learn, and feel supported. Still more orphan children are supported to learn and grow at Humanity First schools. We cannot change what they have endured, but by caring for them today, we help shape what comes next. From hurricanes, floods, and wildfires in the U.S. to crises in Gaza, Ukraine, Pakistan, Turkey, and beyond, Humanity First USA Disaster Relief Program responds where help is needed most. The teams are on the front lines when crisis strikes, delivering rapid relief, medical aid, and essential supplies to affected communities. Recently, in Kerrville and LA, we worked hand in hand with volunteers and partners to bring comfort, stability, and hope when it's needed most. the Humanity First Disaster Relief Medical Team is part of the United Nations World Health Organization Emergency Medical Team Initiative. In fact, our team has been invited by the WHO to respond to major disasters around the world. Globally, almost 3 million people have been assisted during their time of crisis. We don't just assist, we partner. We invest in local leadership and local training for impact that will last far beyond our presence. Humanity First USA has grown steadily since 2004, and the work ahead is even more urgent. From expanding our school network, to scaling food security programs, to strengthening medical services and disaster response, we are committed to meeting human needs with dignity, compassion, and effectiveness. Together, we can create lasting change. Join us, so every person has the chance not just to survive, but to thrive. This is putting humanity first.
Welcome back to Humanity First USA Telethon. My name is Samzada Waleed Ahmed and I serve as the Vice President for Human Development Programs. Today we'll be talking about our food security program. In food security program, we operate several food pantries here in the USA. We have food distributions, we distribute hot meals. Then globally, we work with our partner countries in different areas. For example, serving rations, hot meals during disasters, during droughts, any conflicts. At the same time, we are working on several pilot agriculture projects. So today over here, we'll be focused on our food security program in the USA. We have our Deputy Director of Food Security Program, USA, Waqas Asghar Saab. Then we are going live to two of our pantries. One is Duluth Food Pantry, which is in Georgia, just in the suburbs of Atlanta. Then we'll go to Miami, where we, unfortunately, because of time, we just missed a food distribution. We really wanted to show all of you a live food distribution, but that started at 12 and ended just a few minutes ago, around 2 o'clock. And then same in Atlanta, we had a food distribution today, but that ended a couple of hours ago. So we'll be talking to the team members and volunteers who are in the food pantry at this time. So starting with Waqas, we have Waqas Asghar, who's the Deputy Director of Food Security Program. Welcome, Farooq Saab. Welcome, Muzaffar. So let's go to Waqas Asghar. Waqas Bhai, what do you have for our audience today?
Yeah, thank you, Liz, by giving me opportunity to share some of the data of the food security program in USA.
Waqas Saab, I think you're muted. Can you check your mic? There.
Can you hear me?
Oh, yeah. Yes, you can continue. We can hear you now.
Yes. Yeah. Walid, you can hear me now, right?
Yes.
All right. Thank you, Walid, by giving me opportunity to share some data here in USA. For sports of our esteemed volunteers, we are running almost about 12 to 15 pantries in USA. And every year we are distributing our almost 500,000 pounds of food, and which is basically, if you convert in the meals, is almost 1 million meals we are being serving here in USA. And last year even we served almost 55,000 households, which becomes, if we convert it to families, around almost 10,000 families which we served. And then the biggest thing in this regard is that the very minimum overhead, actually, because of our esteemed volunteers, we have last year 2,200 volunteers, which almost 7,000 volunteer hours they donate for these pantries. And the good thing about that, the work of these volunteers and whatever our members are donating for this cause is directly going to the affected people. And there's thousands of people we are serving every month. Almost on average, we are serving almost about 50 to 60,000 pounds of food every month. And one of the, we'll get the report from Georgia. Muzaffar Sab's Live is one of the biggest distribution center. Another biggest distribution center we have in Hawthorne, New Jersey. They are serving almost 200 to 250 families every month. Same thing, we have a biggest distribution in Fort Worth, Texas. They are serving around 250 families every month. Here in Willingboro, we are serving almost 100 families every month. And I was just talking to last month, one of our, the person who come to get the food from one of our volunteers was talking to them, and I asked them how you feel. And she told us that every month he comes to this pantry, and one more time she goes for the food to get the grocery. So this serves half of the month for her daily needs. So that's the great service, food security, humanity first, food security USA doing in USA. And we are serving almost, as I told you, about 1 million meals every year by the grace of God.
Sorry for the background noise. So we have similar stories that we hear from other food pantries as well. Like we were talking about it some few weeks back that in South Virginia, we get messages from our beneficiaries, from our clients regularly, and they're so heartwarming stories that people who has to decide between either buying food or putting gas in their car so they can go to work, or even buying medicine and paying for the expenses of their children. So the food rations that we distribute that give them that peace of mind that they know that instead of worrying about buying food for the next couple of weeks for their children, they can spend that money on their welfare, on their buying the necessities that those families require. So it may be a small donation on behalf of our donors, but that goes a long way. Every dollar, as Vikas mentioned, that every dollar you donate, we maximize that by procuring in bulk, working with the food banks, and for example, paying 10 cents for a food worth of $1 to $2. So there are many different ways that we constantly work to make sure that your dollar is multiplied 10 times, 15 times, and goes to the right people. So from here, we let's go to Miami. Let's see what Farouk has for us. So Farouk, I understand that you had a food pantry distribution just probably ended 10, 15 minutes ago.
It was a successful food pantry. We do that, every month. So first of all, thank you for the opportunity to speak about the incredible work of Humanity First USA and Humanity First Miami Pantry. The Humanity First Miami Pantry was established in 2016 with one simple mission. The mission was to serve the humanity with dignity, compassion, and consistency. What began as a modest community effort has grown to a viral lifeline for thousands of families across the South Florida. One of our earliest initiatives was a weekly distribution of Panera bread every Friday. When during difficult times, our commitment to serving the community never stopped. Since the pandemic, these bread donations have continued throughout direct pickups and also now regularly donated to Miami Rescue Mission to support those most in need. Over the year, the Humanity First Miami Pantry has proudly served more than 95,000 families. This milestone reflects not only the growing need within our community, but also the dedication of our volunteers and supporters. Uh, just an example, in May 2019, we expanded our services by launching a monthly non-perishable food distribution program, which continues to serve approximately about 50 families every single month. During the early month of COVID-19 pandemic, when families face uncertainty and isolation during the lockdown, our volunteers stepped forward to provide hot meals to the community. At that time, approximately 150 meals were served each month for nearly about 4 months. At that time when masks and sanitizers were difficult to find, our local volunteers also distributed hygiene items, hand sanitizers, handmade masks to help protect the vulnerable member of our community. We are also very proud of our partnership with our city of Hollandale Beach through the Hepburn Center. It's a community program. As food insecurity continues to affect families, the city has worked closely with Humanity First by referring residents to our pantry. In recognition to those efforts, our outstanding service provided by Humanity First Miami, the organization has honored by the city of Hollandale Beach with the prestige Martin Luther King Award in 2022. This award reflects dedication, compassion, and tirelessness service of our volunteers and supporters. At the heart of all it, Humanity First Miami Pantry is about more than food distribution. It is also
Yeah,
about
yeah.
hope, strengthening community, people.
Yeah,
Jazakallah.
so let's go to Muzaffar Qureshi in Duluth. Let's see what's happening in Duluth. Muzaffar, how's everything going over there?
Believe this is going great, and happy Mother's Day to everyone, and welcome to the Humanity First Duluth Food Pantry. And actually, we're actually in sort of the middle of our distribution phase, so this actually works out really well. So, but it's Sunday, and this happens every single week. Families come for support, and our volunteers show up with compassion and with care. I want to begin today by introducing you to Miguel Flores. So Miguel is our bilingual translator, and he helps families to greet them, to register them, and make sure they feel welcome and understood. He's been serving with us for almost 3 years. Miguel, would you like to say a couple words and welcome our viewers?
Hello, everybody. My name is Miguel Flores. I want to take a moment to appreciate each and every one of you guys for watching and supporting Humanity First Duluth Food Pantry. I really appreciate each and every one of you guys. Thank you so much, and have an amazing Mother's Day.
Thank you, Miguel. As of our opening in 2023, the Duluth Food Pantry has served more than 28,000 people, including over 9,200 children and more than 2,000 seniors. That adds up to more than 300,000 pounds of food distributed. And today alone, we're going to serve 65 plus families. But behind every number, there's a real family. And one of those families is represented here today by Miriam Aguilar. Miriam?
Hello.
Hey, Miriam. Can you share with us a little bit, just briefly, how the pantry has helped your family?
This pantry has been a blessing for my family. When sometimes at the time we needed, they were there. It has been a big blessing, and thank you for always supporting my family and all the families that we get here.
Miriam, thank you so much. Thank you so much. What's so special is that Miriam not only receives support here, but she also gives back by helping us with Spanish translation during distributions so we can better serve other families. So now, let's take you back to the warehouse and take a look at where it all comes together for us. Come on back with me. So as you can see, these shelves are stocked because of generous donations and supporters just like you. And thanks to a grant from the Atlanta Community Food Bank, we're able to improve this space with pallet racks that you might be able to see. We were able to get a commercial freezer and other equipment that helps other families, that helps to serve our families a lot more efficiently. I also want to introduce you to one of our dedicated volunteers, Michael Matthews. Michael, where are you? Come on, right here. So Michael has been with us for over the last year, every single Sunday. Michael, just a few words. Could you tell us why you keep coming back?
I would say my family instilled with me an importance to kind of give back and serve my community. And I came in here about a year ago, and they gave me a chance to both effectively and efficiently give back, but also more importantly to me, with care and compassion to serve the greater community that lives around here.
Amazing, Michael. Thank you very much for all your amazing dedicated support. I also want to recognize Miriam Jackson. Miriam,
You can.
So Miriam first came to our pantry in the summer of 2023, where she was part of our, and she's been part of our pantry ever since. She and her son Lattimore have served faithfully with us, and even though Lattimore is now away at college, he still comes back to volunteer wherever he can. Miriam, you're one of our amazing dedicated volunteers. I cannot thank you enough for the amazing work that you've done.
You're welcome. I love working here.
Perfect. Come on back. Let me show you. Let me share with you our commercial pieces. This is something that was given to us through Atlantic Community Food Bank. It's going to be amazing for our future. We can't
So
thank them enough
Muzaffar,
for that. How are we doing on time, Khalid?
yeah. So Muzaffar, we are out of time. So it was really exciting to see the warehouse facility, the food pantry. It was really good to talk to Farouk and Wakas in New Jersey and Miami. So we hope that we had more time. Maybe in the future we can have a deep dive into each of these pantries and show live distributions in real time. So and give some more time to each of these pantry. So with that, thank you so much everyone for joining. Let's go to a video.
Unquestionably, inspiring true service to humanity amongst his followers was a core objective of the advent of the promised Messiah, al-Islam. He repeatedly emphasized the necessity of helping those in need. For example, on one occasion, the Prophet Messiah al-Islam said, "All those who associate yourselves with me must show true compassion to all people, regardless of their religion. You must show kindness to everyone without any discrimination, as this is the teaching of the Holy Quran. As Allah the Almighty says, and they feed for the love of Him, the poor, the orphan, and the prisoner." Chapter 76, verse 9. Elaborating on this Quranic verse, the Prophet Messiah al-Islam explained that a true believer does not help only his own people, but serve all people in need. Thus, though captives and prisoners were often disbelievers, Allah, the Almighty, instructed Muslims to discharge their rights and fulfill their needs to the highest possible degree. In light of this, the Prophet Muhammad further said, "So observe the unparalleled extent of Islam's compassion for all people. Thus, in my view, the perfect moral teaching has been granted exclusively to Islam. Service to humanity, therefore, is a fundamental teaching of the Holy Quran. Moreover, throughout his life, the Holy Prophet ﷺ exemplified this teaching. His heart was forever consumed by a desire to aid and assist all impoverished and vulnerable people, regardless of whether they were Muslims, Christians, Jews, disbelievers, or followers of any other faith. In this era, to revive and uphold the principle of serving mankind selflessly, Allah the Almighty sent the Prophet Messiah al-Islam, and it was to further this objective that Humanity First was established. Consequently, having associated themselves with the Prophet Messiah al-Islam, every Ahmadi must consider it a sacred duty to personify tirelessly strive to alleviate human suffering. Speaking of this duty, the Prophet Islam states, the most perilous and arduous challenge is to fulfill the rights of mankind. Because this is a test and trial that one and an outstanding means of attaining his pleasure and rewards. On another occasion, the Prophet Islam elaborated further. He said, Allah the Almighty repeatedly commands that, irrespective of religion or ethnicity, you should show love and compassion to all people. Allah commands us to feed the hungry, free those shackled in bondage, pay off the arrears of those mired in debt, shoulder the burden of others, and truly fulfill the duties owed to mankind. These teachings are all rooted in the Holy Quran and found their perfect manifestation and expression through the life and character of the Holy Prophet sallallahu alaihi wasallam. Thus, do not consider Humanity First as just another charity or aid agency. Rather, directly underpinning its mission are the commands of Allah, the blessed practice of the Holy Prophet ﷺ, and the teachings of the Prophet Messiah.
Welcome back to the studio. I am here on this session connecting how Humanity First works with the Ahmadiyya Muslim community in a tightly integrated way. We have a full panel of guests here with us today. First, next to me is Munam Naeem Saab, who's the chairman of Humanity First USA. Welcome. Right. And we have Naib Amir, Dr. Hamidur Rahman Sahib on with us, who is the Naib Amir of Ahmadiyya Muslim Community USA, as well as one of the first board members of Humanity First. Naib Amir Saab, can you hear us?
Yeah, assalamu alaikum. Can you hear me? Assalamu alaikum.
We're going to check if anyone else is on. Naib Amir Bilal Rana Saab, are you on? Or Amjad Khan Saab, are you on? While we're checking this,
we have been unmuted by
there we go. Okay. So Naib Amir Hamidur Rahman Saab is on the line. Welcome. We are here in Cote d'Ivoire with Munam Naeem Saab and Naib Amir Saab. Welcome. I know you were one of the first Humanity First board member as well. And then we have Naib Amir Bilal Rana Saib from Houston, Texas in USA. Naib Amir Saab, are you on?
Yes, Assalamu alaikum. Can you hear me okay?
Yes, alhamdulillah. We can hear you all the way in French Guyana and hear you, not French Guyana, in French Cote d'Ivoire, but we can hear you in English. And we have the National Secretary for Amur Kharja or Public Affairs, Amjad Khan Saab. Are you on?
Assalamu alaikum rahmatullah.
Great. I know Amjad Khan Saab and I are a little under the weather as well, right. So we may be a little off. But Munam Naeem Saab, this session is about how Humanity First and the Ahmadiyya Muslim Community USA work together. And I want to share 3 points from Hazur Adillah Ta'ala bin Nasir Aziz's speech in November. 3 points. Hazur says, always remember that unless Humanity First stays firmly attached and aligned with the Jamaat, nothing shall distinguish it from other charities or aid agencies. Hazur goes on to say, Humanity First will always be directly associated with the Jamaat. And then Hazur also says, Humanity First's association with the Jamaat is a source of divine blessings and a means of pride and honor for it. And in one other point, Hazur says, as long as Humanity First continues to seek and follow the guidance of Khilafat and work with an earnest desire to serve others purely for the sake of Allah, it shall continue to flourish and progress. Munam Naim Saab, Humanity First works. How does the Humanity First work with the Jamaat? And there may be some misconceptions, so I wanted you to clear those up, and then we'll bring on the other panelists.
Right. I think, first of all, this profound guidance of Hazur, right, it applies to every Ahmadi, every Jamaat department, including us, right? So Hazur is asking us to work together. And I think Humanity First USA is, in my mind, a model country chapter in that sense, because we work together very well. And, after this address, I think there is, more enthusiasm in the people. So as you will hear from, Naib Amir Saab obviously has been there from day one, but you will hear from Bilal Rana Saab.
You're talking about
from Amur department,
yes,
right?
Yeah, and yes,
Naib Amir Saab, Bilal Rana Saab, he will tell you that how we've been collaborating. Amjad Khan Saab will tell you that how we have been collaborating recently. There was an event that happened, even we may share in that sense there. Sanat Tijarat, is another, great department to get how we will build sustainability and how we get, engagement within the Jamaat. So I think these departments are source to promote Humanity First, and with their help, we can, bring Humanity First out to the world. And that's the vision of Hazur, that, the bigger than Red Cross, it is because of the help of this department, whether that's AMMA. A lot of representatives may not be here, so we brought in just specific departments right now because of the time.
Great. That's really helpful.
Yeah.
That's really helpful. Yeah. And let's see if we can see Naib Amir Hamidur Rahman Saab on the screen here. But Hamidur Rahman Saab, I hope you can hear me. I wanted you to share a little bit about the Jamaat's view. And, you were one of the first board members. You were the first board member of Humanity First. And I recall you had the concept of having these donor pins as well. As we go into the 13th annual telethon, can you share a little bit about your connection to Humanity First, as well as the Jamaat Ahmadiyya Muslim Community USA is connecting with Humanity First USA?
Assalamu alaikum. As you know, the Humanity First USA started under the chairmanship of respected Munim Naim Saab.
I believe we're trying to get Dr. Hamidur Rahman Saab unmuted and on the screen. And as we do that, Naib Amir Saab lives in the Los Angeles area and has done an incredible job of fundraising for Humanity First USA in various ways. And I think we've got him on the screen now. Naib Amir Saab, can you hear us?
Yeah, I can hear. Can you hear me? Okay. It looks like I'm muted by from behind the screen.
We can't hear you yet. Give us 1 second. But your tie looks great.
Oh, thank you. I think I'm muted by.
Okay, now I can hear you. We could hear you.
Can you hear me now?
Yes, we can hear you. Please.
Okay, as I said that Humanities first started in America in 2004 under the chairmanship of respected Munim Naim Saab. It was the time of our respected Amir Ahsan Zafar Saab. And I remember we decided we'll have a budget, first time budget of $25,000. And I was one of the director, but alhamdulillah, we completed that budget, and progressively the Humanity First in America progressed as all over the world. So I always call it was a great seed sown by Hazrat Khalifah Masih Rabi Rahimullah. It was his dream, and it turned into to be Shajara Tayyibah, mean that his blessings are all over the world spread. And you mentioned 66 countries, inshallah ta'ala. It was a vision, and inshallah, very soon this become even a bigger organization, charitable organization, bigger than Oxfam and Red Cross and other organizations. Alma, the blessings are such that all over the world people are being blessed, and our volunteers. This is the most important key in our organization of Humanity First. This is a voluntary organization, and many doctors, many engineers in different fields, they devote themselves to the good work. And
Nasir Saab, as we are currently in Cote d'Ivoire in West Africa, and there's a hospital that we shared that's being built, Masroor Healthcare Center as well. Can you share a little bit about how fundraising in the USA went from that $25,000 budget to today?
Today, well, our respected chairman sir can help. What is the budget now? I'm sure it's in a good amount of, and Munim sir can, I think, later on tell us what is the budget now, but definitely is increased exponentially.
Yeah, but from your perspective, how do we encourage members of the Muslim community and outside members of the USA in general to give to Humanity First?
See, as a matter of fact, the in the Holy Quran, Allah Ta'ala gives us the instruction, and I will read. It's a Surah Ma'arij, that وَالَّذِينَ فِي أَمْوَالِهِمْ حَقٌّ مَعْلُومٌ. Haqqum Ma'lum means anybody, Allah Ta'ala, who's blessed wealth, there's a share, particular share. Allah Ta'ala has mentioned Haqqum Ma'lum, who Lissail wal Mahroom, people who ask and people who have been deprived of. This is a key reason that Jamaat members, they donate, and they continue to donate. And as a matter of fact, just a matter of reminding the members, they donate. And whenever we chance there's a telethon or any tariq to collect, like for the hospital at many hospitals, Nasir Hospital, Alhamdulillah, it was a Jamaat Ahmadiyya assigned, USA was assigned, and Alhamdulillah, all the funds were raised to build that hospital. And this is one example. And any time there's a disaster, there's a announcement comes from the Sadr Saab, from the chairman, or from the Amir Saab, and all the members who are informed. They, alhamdulillah, some members who are the donor on regular basis, monthly basis, some donate at the end of the year, and there's a part of it they do it. And this is a blessing of our
I want to chime in. I want to say something about Ivory Coast. You know, he is, every time there is a need that comes up, or not only regular basis, he's the first one to write the check himself. His wife is the second one. I think and his family is, you know, so it begins from him. And then obviously he spreads the word. He's been not only the Naib Amir, but as ambassador for Humanity First.
That's
so
amazing.
From the day one as a board member, but afterwards, when he was not board member, he is the ambassador.
And it seems like he also shared the chapters giving at the masjid as well. That is all working together. Right. And just want to remind everyone, there's a donate QR code on the screen that they can click on, and we know there was some confusion, and Canada's information was up, but now it is.
No, we were sharing them with them. So,
yeah.
But
so,
right.
so the USA information is up as well. Next, I'd like to invite Naib Amir, Dr. Bilal Rana. We have multiple doctors involved here as well, and Dr. Bilal Rana Sahib is also the Secretary of Amur Kharja. Can you hear us?
Yes, I can.
Rana Sahib, as far as it pertains to Amur Kharja, Amur Amma, how does Amur Amma work with Humanity First? I know there was some disaster planning work that was done hand in hand with Humanity First.
Yes, Assalamu alaikum, Bismillah ar-Rahman ar-Rahim. Greetings to everybody. Thank you for having me on. As introduced, my name is Bilal, and I am the secretary of Amure Amma, which is internal affairs for the Ahmadiyya Muslim community. And yes, we have a collaborative relationship with with the Humanity First, and not only Humanity First, but all of the arms of the Jamaat. And this is the instruction of Khalifatul Masih that we work collaboratively. So not just Humanity First, but Majlis Khudam al-Ahmadiyya, IAAE, which is the engineers group of the Jamaat, the ladies wing of the organization. And when we all come together, we each bring a particular set of skills. And rather than having fragmented work, we work collaboratively, and it's a multiplicative type of effect. Rather than working in silos, there's the risk of duplication of work. There's the risk of not being able to see your blind spots. But when you work together, you can tend to these things, and it has a deeper and greater impact. We've done in our country, United States, these camps with Humanity First and these other organizations that I've mentioned, where we prepare members for disaster. The threat of nuclear strike looms. The threat of civil war looms, of economic collapse. All of these things are not just real. In some senses, they've already begun, and members feel it. And not only do we have to prepare ourselves for ourselves, we have to prepare ourselves to help others. And in the address that Khalifatul Masih, the head of our organization, he made this point, and he stressed it, that we are to help others. What makes, he said, Humanity First different is that we are an organization that is actually for others and not for ourselves. And we help those indiscriminately, regardless of their faith. Matter of fact, we prefer to help those who are different from us, different backgrounds, different ethnicities, different religions, and with no string attached.
And Bilal Saab, as it pertains to working, Humanity First, working with the Jamaat, are there any constraints? Is the Humanity, some people may have had the misconception that Humanity First is a separate entity and cannot work in the Jamaat, but you made it very clear, not only do we work together, not just with Humanity First and others, but as it pertains to Humanity First, and in Hazur Allah Ta'ala bin Nasir Aziz's speech, he made it clear as well. But are there any constraints that you see in Humanity First working with the Jamaat?
No, I think it's liberating, actually. The constraints are experienced when you try to work independently. It's a lot harder. There are people who, for example, have legal expertise that that we may not have in our department, but another department does. And combined, and when working together, they may be people who have better abilities to balance books and to do bookkeeping and auditing. And then what about the volunteer force? Where are you going to get that? How are you going to get access to the ladies? Because the ladies make tremendous contributions in times of difficulty. During the time of the Holy Prophet, there was specialization of effort. Some brought engineering skills. For example, Salman Farsi, he had a background. He was a Persian. He was not an Arab. He learned from the Byzantines, and he gave this idea of digging a ditch around the fort. The ladies, I mentioned the ladies. What did they do? They brought water, and they tended to the wounded, and they worked with their injuries and helped them, nurse them. So it's very important to have specialization of tasks, and we do it as Humanity First in our hospitals. I mean, we see in the operating room, we have a surgeon who does surgery and only surgery. We have an anesthesiologist who does anesthesia. We have respiratory therapists. We have physical therapists. Everyone should recognize that God has given strengths and gifts to us, each of us uniquely. And we have to work, as Allah Ta'ala says in the Quran, in pairs, in groups, collaboratively.
Jazakallah, Naib Amir Bilal Rana Saab. Next, we're gonna invite Amjad Khan Saib, who is the Secretary of Amur Kharja Department or Public Affairs Department, to share how we work together. But before we do that, we're going to share a little bit about how the fundraising is going with in our work here. And the live update, we've crossed $606,000 in funds raised in the USA. MashaAllah, it's going really well. Amjad Khan Saab inspire us to keep growing this number, but also share how Humanity First and Amure Kharja Department, Public Affairs Department, did, particularly in the North Virginia Jamaat as well.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. What a privilege to be on with such an esteemed panel. And it is so delightful to see yourself, Muhammad Sahib, and Munim Saab in Ivory Coast. How inspiring that you would travel so far for this purpose. Jazakallah for this. I think the subject matter is how the Jamaat integrates with Humanity First. You know, I must say, as Dr. Hamid Rahman Saab mentioned with that beautiful quotation from the Quran, that, you know, serving others is kind of, it's imbibed in each of our faiths, and Jamaat volunteers are the engine to keep Humanity First going. We all know that, and our lighthouse is Hazrat Khalifatul Masih. May Allah strengthen his hand, who is his light, his guidance is what sustains Humanity First. And all of us in the Jamaat, we have that lighthouse. In this raging storm, when we are alone on a boat, we have to look to that lighthouse, and that is that lighthouse. And Humanity First is the primary beneficiary of that lighthouse. And so the blessings of Khilafat are inextricably interlinked with the success of Humanity First. And in public affairs and external relations, this relationship is very strong. Last week, we went to Capitol Hill and met with over 100 congressional offices. In each of those meetings, we introduced Humanity First. The respected Munim Naim Saab is there with you in Ivory Coast, but he was in Washington, D.C. last week with us. And he addressed all of the 60 chapters and Muri Kharja secretaries, all of the volunteers who were there. And he made this point that Humanity First introduction, is a great gateway to introduce the Jamaat as well. In fact, many people's first introduction to the Jamaat is through Humanity First, right? So externally, external relations in the Jamaat is, of course, a bridge to Humanity First, and we do not stop those opportunities. There are two examples I wish to share recently. During the iftar dinners that we had, we do interfaith iftar dinners. We introduced the Fast to Feed initiative with Humanity First. And in every one of our external events, we had thousands of people attend that event. We had over 250 public officials attend that event, and Humanity First was introduced. And then recently in Virginia, there was an integrated health clinic that took place in Masjid Mubarak in Northern Virginia. And there were a lot of people, hundreds of people who got medical and dental care. There were so many people, we didn't have enough staff to take care of them. We worked with remote area medical. And that was a great example of integration. The Jamaat, through the Public Affairs Department, through the Alliance for Absolute Justice, which is another department in the United States, and then, of course, Humanity First, we were able to achieve this integrated health clinic, which was the first of its kind. Well, alhamdulillah, we have a very unique opportunity in the Jamaat to assist Humanity First, and we'll continue to do that, inshallah.
Jazakallah, Amjad Khan Saab, Jazakallah, Naib Amir Bilal Rana Saab, and Jazakallah, Naib Amir Hamid Rahman Saab for joining us for a Jamaat panel. We are going, we're a little short on time, so I can't follow up, but we're going to transition to our auxiliary panel where we have Majlis Qudam al-Ahmadiyya, Majlis Ansarullah, and Lajna Imaila with us here. We have from Majlis Qudam al-Ahmadiyya, Sadr Qudam al-Ahmadiyya, Abdullah Dibba Saab, Murabbi Abdullah Dibba Saab, and we have Tahir Sufi Saab representing Majlis Ansarullah, and we have Sadr Lajna Zia Bakr Saiba representing Lajna, and we'll read a few things there, but we'll go to Dibba Saab first. Dibba Saab, how does Majlis Qudam al-Ahmadiyya MK USA work with Humanity First USA in a collaborative manner, and how do both sides benefit from this?
I want to highlight the word that you used, collaboration, is something that as a Khalifatul Masih has guided us over and over, that we must work in collaboration with one another. And Murder Khuddam al-Ahmadiyya in two ways. First is, as our name is, Khuddam al-Ahmadiyya, which is the servants of Ahmadiyya. But it goes, Ahmadiyya also serves all of humanity. So in that case, we provide that manpower, boots on the ground if you want, being present, being called at any time, whether that's disaster response, whether that's distribution of food and volunteering at the pantries. Every aspect of the projects of Humanity First, Khuddam al-Ahmadiyya makes sure that we are at the forefront of it. And every year we also have commitments, financial contribution, where we encourage our members across the country to donate, not only in our personal capacity, but we have a commitment with Humanity First as an organization to take up a project outside of the United States that we fully sponsor. So it's been happening for years, and we'll continue to do that.
So some at times there's a misconception that the youth are not as generous because they're starting out or they don't want to participate. Is that true, or are youth just as generous as other auxiliaries?
There may be some who may not have a lot of dollars in their pocket because they're just beginning their career or they're students, but the spirit is there. And the youth step forward and they donate as much as they can in their sweat and in their dollars as well. So I think that's a misconception. Anytime they've been tested, they've actually gone beyond what's expected. So I'll continue to request Humanity First to keep challenging us, to keep working with us, and we'll continue to be in the forefront to serve in both our sweat as well as our money as well.
Sadr Saab, Madam Saab, can you share?
I just want to say that we are blessed to be, attached with the Khilafat and the guidance that beloved Azul provides us, and that ties us all together. So, but I do want to say thank you to all of the panelists that were there before, that they are, just actively helping and putting it all together. Sadr Saab, youth provide us a lot of resources. Every disaster, food pantry distribution. So as you may say, their contribution may be less in some cases from older people, but their motivation, their hard work is right there at every disaster and every time we need their volunteers. But not only that, they have taken some projects. They have taken some, Dory project that we have now finished for housing there. So that is finished. So hopefully we'll be sharing that with Khuddam al-Ahmadiyya. That was a lot of good donation that they raised. And previously they have raised money for the hospital also to contribute in the Tanzania hospital there. That is about ready to start there. So they are doing a good job.
The youth, I mean, when there's a disaster, they get up and physically go, which is incredible, because a lot of us probably think we're not capable of that, but you're doing some great training to make sure even the Ansar are capable. I'd like to next go to Sadr Lajna Zia Bakr Saiba. Are you on, Sadr Saiba? Sadr Saiba, can you hear us? As we bring Sadr Saiba on. So Sadr Saiba's, I know your video is off, but would you be able to speak so we can see if you can hear us?
I know she was traveling.
Okay. Let's go to Tar Sufi Saab. Let's go to Ansarullah. We'll come back to Lajna Imaila. Tar Sufi Saab is representing Majlis Ansarullah. Tar Sufi Saab, can you hear us? We see you. You seem frozen. And so Ansarullah does a lot of work with Humanity First as well?
Right. I think from auxiliary perspective, they have taken on this Fighting Hunger program, right? And not only, so food pantry support, the Tahir Sufi Sahib himself is also head of our food Fighting Hunger program in USA. So we saw the videos earlier. But from Ansarullah perspective, they do a lot of fundraising from that perspective.
So we looked at the Jamaat on how the different departments of the Jamaat, Umur-e Amma, Sanad al-Tijarat, and Public Affairs. I know your favorite happens to be, we won't make you say it.
It's sitting in front of me, right?
And then the auxiliaries as well,
right.
That are supporting. So it multiplies the impact as well as the volunteerism.
Right.
Is a great model, which goes back to Hazur's guidance that I read in the beginning.
I hope that we get Dear Bakar Sabra online and Tahir Sufi Sahib, because we want to hear from them, right?
Right.
But Lajna as an auxiliary is also been tremendous support from day one. But more recently, we're putting a lot more ask to them, right? Whether there's a disaster response readiness, whether that is
maybe there were some misconceptions before on Lajna's participation.
Well, I think there were in past participation perspective or not, but you can participate. But Azur has told them, no, go out and work in the front lines. So this is how we were talking about our food pantry program, and there's a guidance is that they can run side by side and do the program.
Sadr Lajna can't join us, but she did send a message. First, Happy Mother's Day from Sadr Zia Bakar Saiba. And there was another message from a female as well. One of the greatest responsibilities is living out the prayers, care, and love our mothers poured into us. May God help me honor my mother's devotion and prayers for me. May my life be a tribute to my Ammi as best as I can. So there's several Mother's Day messages. The last one is the third one is in loving memory of my beloved mother who lived a life of simplicity, compassion, and faith, and who raised her family to love God and serve humanity. May Allah shower his mercy upon her, forgive her shortcomings, and grant her highest station in heaven. And one more is love for all mothers, love for all, hatred for none. So I know it's an emotional day for some. Sure. I know you and for those whose mothers have left us a little too soon, I know it's a time for reflection for those individuals as well, and as they care in a great way, and not to be self-serving to Humanity First, but a great way to recognize their mothers. There are individuals using the platform of giving on their behalf, as Sadqa Jariya, as Naib Amir Saab shared as well. And what better way to show love of your mother? It's one thing, and if you can go hug your mother, please do. If you can spend time with her, please do. And you can honor their sacrifice as well.
I think that's a beautiful point that you just brought up. I think what a beautiful gift that you can give to your mother, that if you, in her life, do a water well in her name, that is Sadqa Jariya in her life, or do something for your mother, a gift that is Sadqa Jariya forever, so it's not just one time small, monetary gift or something. So I absolutely agree, but I just wish that these Sadr Lajna and Sadr and Sarul over there, because they've been enormous help.
I mean, they're incredible individuals. And, as we talk about the fundraising, we've raised, the latest update I have is we've raised $606,000. And for those that are watching, and maybe we can send it out through our social media as well, as the ladies auxiliary, Lajna Imaila, is sharing the love of mothers. A lot of them are mothers. A lot of them, we all have a mother, and to recognize mothers. And it would be great if all of us gave something on behalf of our mothers today to connect those two dots as well.
Absolutely, I think.
And just in closing, I'd just like to understand from you back to, just to dispel any misconceptions on how Humanity First is motivated and inclined to work with all chapters within Ahmadiyya Muslim Community USA at the local level to invite people to give of their time, talent, and treasure in terms of supporting Humanity First.
Right. I think a couple of things. That one is that don't hide behind, we are part of Ahmadiyya Muslim community. And
Hazur has made that very clear.
We are proud of that because our faith inspires us. But when we serve, there is no religion, race, color, or anything that comes in the way, right? And we want everyone to join us, regardless of what your faith, religious, color, or region is. So that is one thing. Second, so that misconception is gone. Second thing is that, because it was created as a separate entity, people felt that, no, you cannot work inside the Jamaat because you are created purposely as a separate entity, so raise money from outside and do other things like that. But we have to be the model ourselves. That's what Hazur was telling us. You are the one who has to donate. You're the one who has to contribute your time. You're the one who has to support Humanity First. It begins from you. Then you go out, tell the rest of the world that this is what we're doing. Join us.
Join and give or get. This is one opportunity. If you're a member of the Ahmadi Muslim Community USA, you can ask non-members to give as well. Your friends, your colleagues, your corporations,
your business as well.
Your business.
Remember at the conference,
absolutely,
right?
Absolutely. You know, I mean, I can attest to there's so many Ahmadis, and we promote intra-Ahmadi commerce. And in that work, we as individuals start their businesses, they have come to us. You know, there's a lot of companies who have a model of volunteerism in their corporation as well as giving, and making
matching,
matching as well, to make Humanity First the beneficiary of that. As there are Ahmadi business owners out there, it would continue to give around the world and continue the work.
Absolutely, need is there. We know that our country situation overall, the world is deteriorating. The pressure on us from the food pantry is bigger and bigger and bigger. You know, all of these programs that now is more need. So those who are blessed, you know, I think businesses, if you are doing okay, you're doing good, please
continue.
And the same thing, those individuals who are not affected by this impact.
As Naib Amir Hamid Rahman Saab was saying, that the barakat of giving, you know, comes back to you. You know, you know, you're not. Allah is not going to cheat you in any way. I assume that also applies to our businesses, our neighbors, our communities as well, and they can benefit from that love and grace of Allah as well.
I say that, you know, you give your personal sadaqah all the time to Humanity First or to other things. You need to give your business sadaqah also. You know, so if you're a businessman, if you're an entrepreneur, there is your corporation, put Humanity First name there.
So go ahead, and I think that's where what I've seen in the USA. While someone was asking me earlier today, Dr. Fahim Ahmed, that perhaps doctors get a disproportionate amount of credit for their giving, or not enough. We can all be the judge at our homes, but businessmen and other industries should really demonstrate that and show that in their businesses, even if it's putting up a banner on their website to donate to Humanity First. I mean, there's many ways to give, and Humanity First has opened up all those facilities in order to allow people to come to us.
And then that's business level. Individual level, every one of us could be ambassador to the outside friends, colleagues at work, you know, show them what Humanity First does, right? And I think I think our country is very kind on individual levels, right? I mean, you reach out, people do give.
Yeah, and you know, we need to wrap up this session, but I want to remind individuals that where we started, you know, Hazur's guidance of always remember that unless Humanity First stays firmly attached and aligned with the Jamaat, nothing shall distinguish it from other charities or aid agencies. Humanity First will always be directly associated with the Jamaat. Humanity First association with the Jamaat is a source of divine blessings and a means of pride and honor for it. And Hazur also says, as long as Humanity First continues to seek and follow the guidance of Khilafat and work with an earnest desire to serve others purely for the sake of Allah, it shall continue to flourish and progress. It's a conditional way to get to that over $1 billion budget. Jazakallah, Munam Naeem Saab, Chairman Humanity First. Now we're going to switch to another topic in our USA studios regarding disaster relief from the USA studios in Virginia.
Assalamu alaikum warahmatullahi wabarakatuh. My name is Hamid Harun Malik, and I'm currently serving as a Director Disaster Relief for Humanity First USA. And joining my team from USA, we have Dr. Mahmood Qureshi Sahib, who is serving as Director Disaster Relief for Humanity First International. And then we have Naman Ahmed Sahib, who is serving as Director of Post-Disaster Survival Preparedness for Humanity First USA. And then, last but not least, we have special guest from United Kingdom, Dr. Aziz Hafiz Sahib, who is serving as the Chairman for Humanity First UK. So, gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah for joining us.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
So, for our viewers, today's discussion will be around three things. The first one is to start with is what is the guidance that we have from our beloved Hazur. So we'll go over that and what he has for us for disaster relief. Then we'll talk about where do we stand, what are our current plans, and where do we stand internationally, USA, and then we also have UK. So we'll hear from him as well, Fisab. And then how our viewers, you, the audience, can help us, and where do we stand, and how can you be part of it. So with that, first of all, I would like to come to Dr. Aziz Hafiz Sahib. Um, Aziz Sahib, in our international conference on November 30th, Hazur really appreciated the work that was done by Humanity First UK, right? So Hazur, especially in terms of the Gaza, the work that's going on. And I want to mention that Hazur was very impressed by that. So would you like to say a few words, what's going on, and how this thing is happening? You can share with us, please.
Assalamu alaikum warahmatullahi wabarakatuh. Can you hear me okay?
Yes.
Assalamu alaikum to everyone. Thank you so much for your very kind words. I will just relay you addressed Zur's very kind words, and if those viewers, if they recall, Zur went on to say that the actual people deserving of our prayers and praise are, as you say, the team within Gaza itself, and we're very blessed with a small team that with such dedication has been able to deliver food, water, education, shelter, psychological support across Gaza, hygiene supplies, literally between 5 to 10,000 families every week. And these are volunteers. These are volunteers that sadly, many of them are sleeping on the streets with no shelter over their own heads. And thanks to the huge efforts of branches across the world, hundreds of thousands of dollars from the United States itself, from the United Kingdom, from Germany, from Indonesia, from the Netherlands. Many countries have taken part in this great noble efforts, and all of us are channeling our finances and our support to this young team on the ground. So you've seen a whole gamut of activities, a whole section of activities, and to the extent now where they are receiving between sort of 80 to 100 pallet loads of aid from UNICEF itself every week to distribute. So that gives you a summary, I hope, of the extent of the work that they are carrying out.
Jazakallah. And there will be a video. We will play the video of the Gaza. I would request the viewers to please listen to watch that. Hazur specifically mentioned that that Humanity First UK has provided excellent and devoted service and resolutely faced some of the most horrendous and dangerous possible conditions. In reality, it is the local Humanity First team on the ground in Gaza who are especially deserving of our thanks and prayers. So that's Hazur's words. Jazakallah to you, Aziz Sahib, and thank you for your team. This also tells us about the local effort that is needed. So with that, I would like to come to Dr. Mahmood Qureshi Sahib. Mahmood Sahib, Hazur, in going back to the November conference, Hazur stated that it is no exaggeration to say that the global economic and political situation is increasingly uncertain. Conflicts are erupting around the world. I have said many times, I fear we are drawing ever closer to a catastrophic world war. And if and when such a war occurs, resources will be scarce. Money or valuables will be of little value. So thus, Hazur says, Humanity First should prepare a comprehensive plan for how it will function and provide aid to those in war zones and affected areas. So Hazur further states that you must plan meticulously and train your teams rigorously so they are prepared as much as possible. So with that, Dr. Mahmood Qureshi Sahib, if you can please tell our viewers what is the international plan, how the setup is done, and then how the chapters work on it.
So, Jazakallah, Hamid Malik Saab, and Jazakallah, Dr. Aziz Hafiz Saab. I've been privileged to have worked with him closely in trying to support his work in Gaza and all the other, Middle Eastern countries where he works. And I'm really proud of my collaboration and our collaboration with him. With this, I think the focus is, if I could divide it into three prongs, And I think, yeah, as my title of being in charge for disaster relief globally, making sure that we are working in all 67 countries, preparing them for a disaster, preparing them to be ready when a situation arises. And that's a huge responsibility that we have to take on. And then working with Munim Naeem Saab and Naman Saab and Hamid by yourself in the United States, making sure that all of our Humanity First chapters, all 52 of them or more, are ready and prepared for disaster relief. And then and eventually we go to each individual family, making sure that they are prepared and working in collaboration, as was mentioned previously by Dr. Bilal Rana, with who is the Jamaat Amure AMA secretary, and also with all AMMA Medical Association, with the IEEE Engineering Association, working with the Lajna Ansarullah Khudam. So we are all collaborating to make sure that we are prepared for any disaster. When we talk globally, I think there are 6 areas that we are focusing on. And the 6 areas are making sure that we are able to provide water in a situation where a disaster happens. That's the immediate, scarcity that can happen. The second one is looking at our looking at our food storage and preparation. I think one of the targets that we are trying to do is make sure every family and then every community where there's a chapter of Humanity First is ready to provide for food and water for at least 3 months in their in their local area. And then the third area of focus is making sure that as we prepare for disaster, we carefully look at the needs of women and children and infants and neonates that happen with that. So that's a particular emphasis at the international level from Humanity First, coming down all the way to all our chapters in the United States, and working in collaboration. And the fourth area is to make sure we are ready for urgent and immediate medical needs that may arise when a disaster happens, and trying to prepare, look at our resources that are medical resources and medical providers, and try to integrate them and collaborate with them and prepare them so that when a need arises, they're ready to help. And then the fifth area of work is making sure that we have a process of communication where we can communicate within a chapter, and then we can communicate globally, and we can also communicate with our headquarters, which is in the UK, under Humanity First. And then finally, making sure that we're building those relationships with local authorities, local disaster authorities within our country. So in the United States, we are working with VOAD, and we have Hibbi Iqbal Saab and Maaz Saab, who just recently attended only last week a conference in Reno, Nevada, where all the organizations that are part of VOAD came together as we prepare for disaster. So I think that is the broad scope of the work that we are doing, Hamid bhai, and you can ask any further questions if you want.
So Mahmood bhai, Jazakallah for this. So the would like to what you have at the international level. This is what we are following up in our countries as well. So we also talked, regularly as well. We have meetings as well. And one important thing that Hazur mentioned, and again Hazur has mentioned that, and that is the relationship between Jamaat and Humanity First. What is Humanity First? Is a Jamaat separate or not? So Hazur specifically in that same conference, Hazur says, explaining the relationship, Hazur says the reality is and always shall be that Humanity First direct association with the Ahmadiyya Muslim community is a source of divine blessings and a means of pride and honor for it. Further, Hazur states, always remember that unless Humanity First stays firmly attached and aligned with the Ahmadiyya Muslim community, nothing shall distinguish it from other charities or aid agencies. So in that context, we'd like to mention what we are doing in USA. So in terms of, we talk about, walk the talk. Here we have in USA, the Jazakallah to our Amir Saab, we are working together. The committee has been formed that is with Humanity First, Amure Amma, auxiliary heads. So we have that committee, right? And then also it includes AMMA, MD Medical, Doctor Medical Association, and the engineers and architects as well. So that is what we are doing, and this is where I would request our Jamaat members, our viewership, to be part of it. They should know what's going on, and also not just going on, but how can they help us, right? Because what we need first responders in every chapter. Every chapter has to be prepared. And that's where, Naman Bhai also comes in, Naman Ahmed Saab. He is the director. He's the one who's working with Munam Saab and Muriyama in providing that training. So I would, Mahmood Bhai, if you have a few seconds to say something on that, I would like to go to Naman Bhai to tell us where do we stand, how many trainings have happened, and what's the next step there?
I think the beauty of the model that we are trying to practice in the United States is collaborating with all the entities in the Jamaat. And I'm very closely working with the MD Medical Association in the US, where we have a thing called MDNet, where we have resources of physician providers who can be a resource when a disaster happens. So we have a network, and we are building it together under the Amir Jamaat of USA with the Muriyama department in the USA. And I think Numan, I'm going to go to you to speak on it, because you are the frontline person who is leading that effort in making sure that Humanity First is collaborating and working closely with the Jamaat resources. So Numan.
Assalamu alaikum. Jazakallah, Dr. Saab, and Jazakallah, Hamid Bhai. It seems like it's always a challenge. We're trying to keep up with the expectations of Hazur Anwar Allah Ta'ala bin Nasir Aziz. He's guided us many times to prepare our Jamaats, prepare our individuals at home, all the preparations, and it seems like we are always trying to catch up. What we have done under the part of the committee that Hamid Bhai you just talked about, you mentioned, as the committee has organized these training camps, and these training camps are designed to prepare, or what we call train the trainers. So regional-based training camps, the first one that we had conducted last year, that was in New Jersey at Bagh Ahmad, the Khudam al-Anbiya property. And we had about 80 participants in that camp, and mostly it was Khudam and Ansar. And in that training camp, there were several workshops that were conducted. We trained on how to make a fire, how to water sanitation, cooking on wood, and all the primitive skills that are needed for survival. Those were shared with the camp participants. After that camp, we had another camp in April of this year that was in Texas. And in this camp, based on instructions and guidance from Hazur Anwar, Allah Ta'ala bin Nasir Aziz, we were able to include Lajna in that camp. And in this camp, we learned on some of those areas that we need to focus on, such as Parda matters, how we have to have a separate area for Lajna, yet we have to be able to provide for their security. And after that camp, in fact, I'm just getting back on the way right now, Ahmed Bhai, from coming back from the camp. We just concluded in Ohio, in which we also had approximately between 50 and 60 participants. So this is the third training of its kind, where we provided comprehensive training to Jamaat participants and regional-based training. So a few select participants from each Jamaat who came, who learned these skills, and we're hoping that they take these skills back. Throughout the camp, we emphasized on the guidance that Hazur has provided us with. We played some clips of Hazur Anwar Allah Ta'ala bin Nasir Aziz, in which Hazur has specifically talked about have preparedness at home and Jamaat's preparedness.
You are the real example, you are doing it. So we had a camp in North Jersey, you were there. Then we had it in Texas, you were there. So again, you are leading by example. So I really appreciate it. Jazakallah for that. Now, and then we also, right now you're in Ohio. Now we have 2 more we are planning to work on. So Jazakallah everyone for participating. Again, my request to the viewers is that let's see, where do we stand? Where do you stand? And in Hazur's instructions, are you part of it or not, right? So would request, we are here, and please ask us if something is not happening, let us know, and we'll work with you on that. I would like to conclude this session with Hazur's remarks that Hazur gave on November the international conference. Hazur says, may Humanity First always live up to the noble aspirations with which it was founded and shine as a beacon of hope and mercy for generations to come. Ameen. May Allah enable us to do so. Jazakumullah, Assalamu alaikum wa rahmatullahi wa barakatuhu. Now, after this, we will be playing the Gaza video, so please stay tuned. Jazakallah for listening and watching.
Children. Furthermore, for several years, Humanity First has run eye clinics and camps through the Gift of Sight programs, in which thousands of people have had their sight restored or improved. Beyond these crucial ongoing programs, Humanity First's mission also requires it to mobilize immediately to meet the urgent and often unexpected needs of the time. Thus, with the grace and mercy of Allah, over the past 2 years, in response to the devastating and horrific situation to Gaza, Humanity First UK has provided excellent and devoted service and resolutely faced some of the most horrendous and dangerous possible conditions. In reality, it is the local Humanity First team on the ground in Gaza who are especially deserving of our thanks and prayers. With remarkable courage and dignity, and without any consideration for their own comfort or safety, they have selflessly served the local people. They have been motivated and driven only by a profound desire to demonstrate the mercy and compassion at the heart of Islamic teachings. May Allah, the Almighty, reward them and keep them all in His protection. During the course of the conflict, I have myself seen how some members of the Humanity First team in Gaza have physically weakened. They are sacrificing their own well-being and health for the sake of others. Yet they have never once wavered or shirked their responsibilities. As a result, they have provided food, water, supplies, and other and shelters to thousands of people in desperate need. Every penny spent by Humanity First in Gaza has reached the people on the ground, bringing them desperately needed comfort and relief. Indeed, other well-known aid agencies and charities have commended Humanity First's efforts, and I'm sure the relevant UN agencies will also testify to this if they are fair and honest.
Hello. Hello, everyone. Thank you so much for everyone who's watching today's HFUSA Telethon 2026. I'm Elena Ladone. I lead fund development and marketing for Humanity First USA. So I need to say an extra special thank you to all of our donors. It is only through your generosity and how much you care about other people around the world that HFUSA is able to have the impact that we do. So thank you very much. And I'm so excited today to be joined in this segment by three amazing women who make some of that impact come to life in three very different realms of Humanity First's work. So without further ado, I'd love to speak first, since we're just coming from our disaster relief segment with Dr. Khadijat Ogumie, who is the Health and Fitness Secretary for Lajna Amila, one of the core partners of HF. Doctor, are you here?
Yes, I am. Thank you, Elena.
Wonderful. I'm so glad. So you're a leader in our partner in the women's auxiliary of the Ahmadiyya Muslim community, and you have many roles. But would you tell us a little bit about the role that you play in disaster preparedness?
Okay. Thank you so much, Elena. We started the disaster preparation. I think they called it as disaster preparation. That's over a year ago. So we've been having regular meetings. There are core members that were selected at the Shura that was held in 2024 in November. So since then, we've had regular meetings, and Alhamdulillah, we've been able to create several modules of disaster preparedness. We have about 8 now, and we've had about several camps. And this weekend, they're holding a camp in Ohio. So a 2-day camp where, they have practical demonstration of preparedness for a huge disaster that everybody's worried about. So that's what we've been doing. So we are training the trainers now, and then the trainers now will go into the community and train people on how to get ready individually, Jamaat level, and then nationally. So that's the way we are approaching it. Thank you.
That's fantastic. I know that people are worried, and preparation is very important. When Humanity First USA deploys in disaster, women have played multiple roles, from logistics to managing volunteers, distributing supplies, cleaning debris, kind of anything and everything. If they have special skills in medical or legal, they've helped there too. So given all this preparation, how should women think about preparing for a disaster so they can take care of their families and also be able and ready to help others?
Yes, I'm very passionate about this, and like they say, charity begins at home, and I've been encouraging women on our various platforms too, that please get ready. And it starts with the individual families. If you go to Humanity First website, you see that there is a list of family preparedness. The list of things you're supposed to have in the house. Say probably it's just probably something that is just a small scale disaster, something local, probably you have like tornado and all. So you have things that will sustain you for at least 30 days. Then you now have the list that is bigger, probably for the Jamaat, that the Jamaat will take care of. And that is usually stored in the mosque. And then the bigger one is the one that, like we're talking about probably nuclear war or something. So how should we be prepared? God forbid. But that if you go to the Humanity First website, you find out that you have so much resources there. Then on Lajna website too, we also have something we call the Build Your Ark too. So it shows you step by step on what you're supposed to do. And then people have been asking me about the kit, the disaster kit. The link is also on Humanity website. So you don't need to buy them in bits and pieces. Just go there, get your kit for your family, and be ready. So we all, like I always say, we are the focus of each family, the unit. You hold the strongest power. If you move, your family moves with you, your children will come with you, your husband will be prepared. You can ginger them that, look, Huzur has been talking about this for so long. Let's get ready. This is the time to get ready. This is not the time to dilly-dally. So every family should be prepared. And I think the women will, if they are pushing and they are with us, will do it quickly too. Thank you.
That's excellent advice. And thank you for pointing out that there are resources available from our partners as well as from Humanity First, including that kit. So if you could leave us with one top disaster preparedness tip for women who are preparing their homes or themselves.
Yeah, I think the most important thing is for us to know that life is a gift. Don't take life for granted. We hear about all these stories. I think lots of us are in denial. But if you're prepared, if nothing happens, that's okay. But if you are not prepared, it will be very disastrous for you and your individual family. So let's go out and get prepared, no matter what. Ask questions, and like we just said, and with what we are discussing, the Huzur has prepared us. Let's follow his lead, because he said, he's reminded us all the time, let's just follow his lead. And we have resources. The Jamaat cares about us, so let's care about ourselves too, you know. So let's just follow our leader. Thank you.
Yeah, thank you, Doctor. That was perfect. We really appreciate hearing from you on this. I would love now to turn to Farah Qureshi. She is the director of the HF Duluth Food Pantry in Georgia. This is about our food security program, which she's leading. Although the pantry was able to support during a time of disaster when there was a hurricane in the Georgia area, sending food over to families in need, which was a really important connection that can be made because Humanity First has so many diverse programs. So Farah, let's talk about the pantry. Tell us the 30-second overview.
Well, thank you, first of all, Alana, for having me on. I'm really happy to be here and be part of this panel. So here at Humanity First Duluth Food Pantry, we see every week that hunger is not just a number. It's a parent worried about feeding their children, a senior choosing between groceries and medicine, or a family doing everything right and still falling behind. Because we have our own dedicated space, we're able to serve every single Sunday, and we serve an average of 195 families each month. Each family receives about 60 pounds of food, roughly around 50 meals, so we can bring something nourishing home. In the past 3 years alone, we've reached more than 28,000 individuals, including over 9,200 children and over 2,000 seniors. That's why this pantry matters. It lets families know they're not alone.
That's amazing impact. Thank you for sharing all of that. So you lead the pantry and have a team of volunteers that help support all of this work. What do women do? What are the roles that they play in all of the different facets of getting food to people who need it?
So women play a really vital role in every part of Humanity First Duluth Food Pantry. In fact, the majority of our core team are women and have served faithfully for the past 6 years with incredible dedication and heart. They lead community outreach, they provide on-site support every single week, and even step in to pick up large quantities of food from the Atlanta Community Food Bank when our supplies have run low. We also have dedicated women volunteers. And by the way, these are just Gwinnett County residents from all walks of life working behind the scenes each week to keep our warehouse and distributions running smoothly. Their compassion, strength, and consistency are truly the backbone of this pantry. And without them, the impact we make in the community simply would not be possible.
That's awesome. I love hearing about how this work is. I mean, it just takes so many people to make it happen, but it's so important. It's worth everyone's time and effort and support. So thank you to everyone who has been a part of this. And it is like you're saying, with all these people working, it's so much. It takes so much effort to do this, but it's worth it. Can you tell us a story you've heard from a beneficiary that you keep in your mind so that you know how much it all means?
Yeah, so over the past 3 years, we have built a real sense of trust with families we serve. And so that means so much to us. One story that has stayed with me is from a mother who told us our food support has made a real difference for her family because she can't work full-time while caring for her disabled child. She shared how much it means to have a safe and respectful place she can come each month, knowing food will be there for her family. Stories like that remind us that this work is more than just groceries. It's about easing stress, restoring dignity, and letting families know they are not alone.
Thank you for sharing that. I'm on this Mother's Day. It's really nice to know that we're helping mothers who are just trying so hard to feed their families every week and every month. So thank you, Farah. It was great to speak with you. I'd love now to turn to Dr. Namuda Sahar Rana. She is an HFUSA ambassador out of the Boston area. Doctor, are you with us?
Yes, I am here.
Excellent.
Thank you for having me.
Yes, thank you. Thank you for being on. So you've been a volunteer with HFUSA for 10 years, I believe. What drew you to being a volunteer, and tell us a little bit more about what an ambassador does?
Sure. So the idea of volunteering comes naturally with the medical profession and my upbringing. Both my parents, my mother she had a background of teaching, and my father served military and was a physician himself. So both my parents instilled the importance of giving back to the community. And I've been working with Humanity First for a little more than 10 years. And as an ambassador for Women's Division here in Massachusetts, Greater Boston area, my job is to spread the word and information and collect donations. And I was personally very fortunate. I was fortunate enough to attend the inauguration of Nasir Hospital in Guatemala, along with my parents, my siblings, and my son. And it was fantastic to see the inauguration, and we were fortunate to firsthand see the amazing work in action. So that was wonderful.
Wow. Yes, I heard that was a huge event. And the hospital continues to do amazing work. I'm so glad that you were there and that you've carried all of that inspiration forward into your work now in Boston. So you have a job that some people would love. It's really exciting to be able to talk to everyone in your chapter about all the impact that HFUSA has, bringing clean water, high quality education, food, relief from disaster to people around the world. Other people may find that job a little difficult or scary. How do you think about it?
Elena, it's a responsibility and opportunity at the same time. Whether joyful or scary, the real thing is how meaningful is the cause. Not just talking to people, but sharing real stories and the impact that changes people's lives. Personally, I see it as a chance to learn how to communicate at a grassroots level and make relationships and prove that small contributions can make a big difference. It goes a long way. And I would like to mention a name in our chapter. I've met many passionate, compassionate, and caring people who are regular donors and contributors. But my dear friend and sister, Amtul Hafiz, she's a retired teacher from Boston, and regularly she contributes into all these different projects from Humanity First. And people like her are an inspiration for all of us.
That's wonderful. Please say thank you to her from me, from all of us, and to everyone that works with you in the Boston area. I'd love to hear a final question from you. What is the Humanity First program that most inspires you and you care the most about?
I think all these programs are very thoughtful, very impactful, and they provide basic needs. And it reminds us why service matters in the first place. If I have to choose personally, I think Water for Life represents something life-changing, something that transforms health, education at the very basic level, something so essential that can completely change a child's future or actually community's future at large.
Yes, that is so well said. It is, I mean, water is life. So thank you very much for sharing that. I am just very grateful and so happy to have been joined in this segment by three wonderful women on this Mother's Day, Dr. Rana, Dr. Ogbude, and Farah Qureshi. Thank you for joining us, and we'll turn it back to the studio for another video.
Mm-hmm.
Thank you for having us.
Thank you for having us. Mm-hmm.
Thank you, Rana.
To share my ongoing journey with Humanity First. I'm an ophthalmologist and cornea specialist based out of the United States. And as with all good things, my partnership with Humanity First and their Gift of Sight program began serendipitously. As a senior resident, I was looking to get involved with global health and global ophthalmology. I was connected with Dr. Bouchard's team and eventually to the Humanity First Gift of Sight program. After months of planning, I joined a dedicated team of volunteer physicians, nurses, residents, medical students, and support staff and traveled to Guatemala to serve at Nasir Hospital, a state-of-the-art facility in the Zacatepec region. The hospital, opened by Humanity First in 2018, provides equitable care to people of all socioeconomic backgrounds. I was impressed by the breadth of services available, from emergency care to a neonatal ICU, inpatient wards, specialty clinics, and 2 operating rooms. Our mission that first year was to screen and treat more than 150 patients in need of advanced eye care. Many came to us with debilitating cataracts and pterygia, but we also saw trauma cases, tumors, infections, glaucoma, and complex retinal disease. By the end of the week, we had performed over 80 life-changing surgeries, restoring vision to patients who had lost their ability to live and work independently. This year, I had the privilege of returning for a second mission trip, and the experience deepened my appreciation for what we are building together. Seeing familiar faces, both among the team and the local staff, and of course being welcomed by returning patients and families, reminded me that this isn't just a one-time effort. It's an ongoing commitment to building sustainable, long-term care. The progress made over the past few years has been remarkable. The Department of Ophthalmology at Nasir Hospital, a partnership between Humanity First USA and Loyola Medicine, is taking root and expanding. With the continued recruitment of full-time optometrists and surgeons and additional mission trips already underway, the vision of a self-sustaining eye care hub in Guatemala is no longer a dream because it's becoming a reality. This second mission allowed me to see not only the impact of our work, but also the personal connections we form with patients, staff, and fellow volunteers. It reinforced why I do this work, not just for the chance to restore sight, but to be part of something that brings hope, dignity, and opportunity to entire communities. As a volunteer eye surgeon, I've seen firsthand how transformative access to eye care can be, how a simple procedure can give someone back their independence, their ability to work, to take care of their families, and to live fully. Each time I operate, I think about the ripple effect we're creating. It's not just the patient who benefits, it's their families, their communities, and future generations. To those of you who support Humanity First through donations, volunteering, or simply spreading the word, please know this: your generosity has a real, visible impact. You're helping restore sight, restore lives, and restore hope. And for that, we're all deeply grateful.
Helping us develop our projects and also support our dream as well. Let's take a look at our donations that we've been receiving all across the country. So as we can see, we have 154 donors from Texas. Amazing job. We also have 69 donors from Virginia, and we have around 62 donors from California. So as we see, we're slowly filling in the map, and we have over $736,000 in donations. So thank you all so much for supporting us at Humanity First. So if we take a look down at our donor honor roll, we see that Amir Ahmed from Florida, US donated, so thank you so much for that. We have a couple anonymous notifications here as well, and we also have Namid Malik as well from Maryland, United States. So thank you so much for donating for us. But why are these people donating? Why should you donate to Humanity First, and what projects do you want to support? One major project is that education. You know, we all go through school, but there are many students all across the world who cannot afford to have school or go through an education. For just a small price of $150, you can support a child's entire year of education. Just think about how amazing that is. Additionally, we also specialize in giving people's sight back through our gift of sight missions. For just $150, just imagine, from someone who can't see at all, you can see the entire world. You can go back to class. You can see your family. You can see your parents. This is an amazing thing that Humanity First does, and this is why I urge you to donate to our gift of sight program here. Additionally, we have a Healthcare for All program in which, for just a small amount of $80, we allow for a whole diagnosis process at Nasir Hospital. We also specialize in natural disaster responses. We have supported our program teams in Palestine, in Jamaica through the hurricane recently, the Texas floods, the Myanmar earthquakes. So think, Humanity First is different and special because when something happens in these countries, a natural disaster, a hurricane, an earthquake, we are there. We assemble a team of physicians, of hardworking and dedicated volunteers to come out to these countries because we serve with purpose, we serve with dignity, and the first thing that we want to do is make sure that everyone has a blessed life and everyone, but your donations make a difference. One of my favorite programs I really want to urge you guys to donate for is the Water for Life program. So just imagine, right? We have all clean drinking water in our houses, but across the world, some of these people don't have the clean drinking supplies to fresh to drink water out. But just for a small price, we have served over 2.6 million people who have drinking clean water. Additionally, we have over 1,700 installations, and we're serving currently 5 countries. So I urge you all to look at these programs, and if you have the heart, open up your hearts and give a little bit of money, because just a small amount of money can bring a long way and change hundreds and hundreds of lives. And your impact matters to Humanity First, and we are waiting for your support. Thank you.
Hello, this is Munam Naeem. I am the Executive Director and the Chairman of Humanity First USA. About 2 weeks ago on September 6th, we, on behalf of Humanity First International, set out a journey of 100,000 kilometers of walk, run, and bike. The plan was that we will complete 100,000 kilometers, touching the 65 countries virtually where Humanity First serves in literally all continents of the globe. So we started this by the grace of God, that we have not only completed this journey of 100,000 kilometers of walk, run, bike, and other sports activities, adding steps to our journey, that we kept moving this flag from one country to another country to another country, that we have completed 400,000 kilometers. This is 4 times the goal that we had set out of the 100,000 kilometers. Over 57 countries across the globe, from East Africa, West Africa, South Africa, Asia, North America, South and Central America, Europe, Middle East, and Pacific nations participated with over 57,000 activity participants. And as team and as individual, they added the steps, and the purpose was literally to introduce Humanity First to the world and the needs of humanity and the programs that Humanity First serves. So this is a remarkable achievement, and I wanted to congratulate everyone on this remarkable journey. And if you simply add these 400,000 kilometers and circumference of the world, the circle around the world is literally 40,000 kilometers. So we have done 10 circles around with the help of everybody. So I just wanted to say my thank you to all participants in every country who have stepped up, joined us. And I'd like to say thank you to all the team that has worked in the background supporting. It has nothing but a very enthusiastic response, and is amazing and inspiring that how people came from different parts of the world and joined our hands to complete this wonderful target 4x from 100,000 kilometers to 400,000 kilometers. I feel this is a record setting, or at least for all of us, to complete this journey. So I'd like to congratulate. We hope that with this accomplishment, showing to the world that the passionate Humanity First
volunteer across the globe mean what they do to serve humanity. And we hope that we become a charity of your choice, that you support us all. You join our hands as volunteer. You work together with us as corporation to serve those people in need with the 8 major programs, including disaster response, including global health, building hospitals, schools, and medical missions and clinic and capacity building mission, to providing education in America here through our student organizations. 50 campuses have student organization, including those the online tuition program, to building and operating 100 schools across the globe, providing education, providing safe, clean, drinkable water, fighting hunger in America and across the globe in all the countries that we serve in. Again, that those are major programs that we carry out, orphan care programs and other community care programs. The need is out there. Some of these needs are kind of silent killers. A lot of time people don't realize because they're disaster. When it comes public and news media picks it up and distributes it, people come forward and donate. But a lot of time, the safe, clean, drinkable water, or the health issues, or the education problems, or the even going to bed hungry, those issues are not surfaced, and Humanity First is there. So I thank you for all of thank you to all of those who will support us, and I just also would like to say thank you to all who will join our hands in the future. Thank you again. Congratulations.
Assalamualaikum. Happy Mother's Day to all the mothers and mamas around the world. It's very good to see everybody. On behalf of Kids for Humanity, we wish you a very nice and happy Mother's Day. My name is Safir Bhatti. I serve as the Director for Kids for Humanity.
Wait. Let me tell Kids for Humanity is. Kids for Humanity is kids like us. We are boys and girls between the ages of 7 to 15.
We are located in North Virginia, South Virginia, Maryland, Philadelphia, Baltimore, Miami, Central Jersey, Oshkosh, and Tulsa.
And we could be near you. You need to find the youth coordinator in your chapter. Have them sign up on the website and we can form a chapter. To come think of it, there's no chapters in Iowa, so now I'm going to work hard to find one. Join me or let me for chapters.
But I'm confused. What does Kids for Humanity do?
Arusha, what does Kids for Humanity do?
We serve our local communities by working in food drives like in Atlanta, Miami, and Willingboro, where you can see kids like us supply food and bags and give to the needy. We help other kids our book bags and school supplies. We help our country by making it look beautiful, preserving the environment, freshening the roads, streets, and beaches. We help with national Humanity First events like the telethon.
We help our world by raising money for the Masur School in Guatemala, helping them with resources, school books and supplies, a new gym, transportation, and a new facility. We help our international campaigns. We do so much.
But we can't do it alone and we need your help.
Kids for Humanity serves mankind, right? Right.
Right.
Well then, we need to serve our moms today for Mother's Day. Mom, I love you so much. Thank you for raising me, loving me, and always being there for me.
Mama, I love you. You're M for magnificent, A for awesome, M for marvelous, and A for Risha's mom. Thank you for teaching me to serve others. So come on, everyone, donate today so kids like us can go to the best school in Guatemala. Support Kids for Humanity. Support the 23 schools that we have for Knowledge for Life.
Mom, you taught me the importance of respect and love. And there are people in Africa that do not have water. But if we get together and raise $1,500, we can give water to 5,000 people. That water is better than any Fiji, Saratoga, or Dasani water you drink. Support Water for Life today.
Mom, thank you. I love you so much because you taught me to see with freedom. But there are kids around the world that cannot see. So let's support them by raising money so we can perform our eye surgeries through Humanity First. We have our own Nasir Hospital in Guatemala and an eye institute in Burkina Faso. We just need your support.
Miriam, go ahead. Arsha, go ahead.
Oh. Mom, thank you so much for everything. Your dedication, humbleness taught me to serve others. That's why all of us should visit our local chapter and give food during our local food drives to the community. Willingboro is a federal food drive that has given more than 100,000 pounds of food and served thousands of people. You should see the pictures. They're paranormal. We don't know who needs food, but we know that people are needed at our levels. Join your local chapter, food security program, and help serve them.
Bob, thank you for being you. You're very special to me, like everyone's mom is special for them. Moms all around the world need your love to make them special. Moms all around the world need your love to make them special. These moms are those moms who carry water for 7 hours straight to provide for their kids. Give them the gift of clean water. These moms are our teachers who work in basic conditions to educate our kids in Humanity First schools. Give them a better school so their lives are easier to teach. These moms are our doctors and our nurses. Spread the love. Sharing is caring.
Don't forget to join Kids for Humanity. It's only $10 for the year. We want you to become a humanitarian just like me. I am 8 years old and I do many things for Kids Humanity First. Go to kidsforhumanity.org and become a member. And don't forget to give something, even if it's a few dollars, to the Nasir School in Guatemala, so kids like me and you can have a chance for education.
Miriam, did you say something about youth coordinators in the beginning?
Yes, Safir, Uncle, they are waiting for you.
Okay. So let me go ahead and now introduce Shanze Saiba, who's our coordinator for marketing. And she will have a very nice conversation with our youth coordinators next in segment 2. Thank you.
Every day, millions of people around the world face an invisible crisis, a lack of access to basic health care. From urban neighborhoods to remote villages, the barriers are immense. Overcrowded clinics, long travel distances or wait times, insufficient medical staff, and the financial burden of treatment. Imagine not being able to have a doctor check your growing child to make sure she stays healthy. Or managing a chronic condition when the clinics require hours of travel, or needing a surgery that no one has the skill set to perform. These are the realities faced by countless communities across the globe. At Humanity First USA, we believe healthcare is a fundamental right, not a privilege. That's why we are committed to addressing these challenges to provide life-giving healthcare around the world. We build hospitals like the Nasir Hospital in Guatemala, which serves over 10,000 people each year, providing essential treatments and ongoing care.
Aditya, what do you think?
It's beautiful. Nasir Hospital is amazing.
We also send vital medicine and supplies to our partners, boosting local resources and enhancing the capacity of community clinics. This ensures consistent and reliable care, even in the face of shortages. In Bamako, Mali, our health center stands as the only 24-hour medical facility in the region. Thousands of people rely on it for uninterrupted care. For those who cannot reach a hospital, Humanity First USA operates mobile medical clinics, bringing healthcare directly to communities. These clinics and camps ensure that patients, even in remote locations, receive the attention they need. Doctors for Humanity, our network of volunteer medical professionals, is at the heart of our global health efforts.
So I think what we did here, what Dr. Fahim and Jane was doing here, is really important, very important.
Whether responding to disasters, conducting training, or fundraising for vital healthcare initiatives, these heroes bring hope to thousands. Our dedicated medical missions unite volunteer medical professionals from the United States and abroad. Together, they host health screenings, provide critical treatments, and ensure no one is left behind. Building a sustainable future means investing in education. Medical professionals build capacity in our partner countries by teaching courses to doctors, nurses, and non-medical staff. From emergency first aid to advanced surgical techniques, these training missions improve the quality of patient care now and far into the future.
Which is pretty much all in one, has the camera as well as the equipment that you need to practice your laparoscopic skills. We also have some other lab trainers set up here. We have surgeons practicing the skills before we go into the operating theater.
And our Humanity First Student Division leads learning exchanges, where U.S. pre-med and medical students participate in trips to countries like Guyana and Guatemala. They assist with patient care, shadow experienced doctors, and learn what it means to deliver compassionate service in low-resource settings. These programs not only provide immediate assistance, but inspire a new generation of medical professionals to continue serving those in need.
Hi, my name is Mo. Once again, I'm grateful for this opportunity from Humanity First. Today, I learned how to take vitals, blood pressure, ask specific questions, especially family-related issues.
Just for this day alone, and we had to expand our clinic from 4 clinics to 6 clinics. That's how much need there is. So it's amazing to see how we have this 6 clinic operation, and we're seeing over hundreds and hundreds of patients every day. And it's amazing how Humanity First is able to do this.
With your support, we can continue expanding our reach, delivering more medical missions, building more facilities, and training more local professionals. Join us in this mission to bring healthcare to everyone, everywhere.
Assalamu alaikum. My name is Shanta Hamid. I serve as the coordinator for marketing for Kids for Humanity. Today we have our youth coordinators from around the country who will share their experiences with you. I'm going to start with Hira Saiba, our youth coordinator from Miami.
Assalamualaikum. My name is Hera Ahmed. I recently joined the Kids for Humanity team as youth coordinator. In Miami, our kids have participated in the local food pantry by giving food to the needy. They work with our ambassador, Ismat Raja Saiba, and help make school bags for children. They've also worked on raising money for different campaign initiatives that Manavir Chaudhry Sahib, our ambassador, has advised us to contribute to. They made flyers and they also encourage people to donate to the Guatemala Mansour School.
At North Virginia, we already have youth that are very active in Humanity First. Recently, they raised $50 all on their own by contacting their neighbors and their school faculty and teachers. For Kids for Humanity, we actually decided to do something a little bit more fun and host a sports tournament for kids to basically mingle and then talk to each other and think of ways that they can fundraise. In the future, we have a new initiative called the National Literacy Equity Initiative, where kids will be able to help other kids their age and in their community and help each other raise money for winter clothing, school supplies, and food. And together they'll be able to create a better community for the ones around them.
Oh, that's awesome. Naima, how about you?
Yeah, so Assalamu alaikum. My name is Naima Awan. To join you guys today as a part of Humanity First Youth Coordinators team for the Telethon 2026. I'm really excited to share this news with you that we are launching a new Kids for Humanity chapter in our area. And let me tell you one thing, that our Boston youth are pretty very active and passionate, and I'm really thrilled to organize them under this beautiful banner of Humanity Service. Many of them have created their own fundraising pages in the past for Humanity First. Their dedication in fundraising from neighbors and family gives me hope that we will do great things ahead, inshallah. One of our goals this year is to connect our youth with the children of Masroor School, Guatemala. And this is to give them a reminder that we are one family standing together across the borders. And to make this vision a reality, we need your support. Your donation or pledge today will help us reach our chapter goal and empower our youth to serve with compassion and purpose. May Allah bless your generosity today and make it a source of lasting blessings. Ameen.
Thank you so much. Right. So everyone watching, if you're interested in becoming a youth coordinator, please do that today. You can join our family of volunteers for an opportunity to shape the future, become a youth coordinator, and please don't forget to donate so we can help all the kids who are serviced by Humanity First every day a chance on enjoying life. Jazakallah.
Hey everyone, my name is Fahim Ahmed, and I'm one of the HFSO Virginia Commonwealth University co-presidents. Today, I'll be showing you the journey and impact from HFSOs from over 54 chapters, including college and high school chapters, to show the impact of what Humanity First student organization really does.
Hello everyone, my name is Maher and I'm Elise. And today is our last event for Humanity First at UIC. We're going to the Pilsen Food Pantry and we're going to be packing some food. Yep, so we're going to take you guys with us.
Once we went in, they gave us the stations that we will be working on. So this is where Elise was working. She's packing canned foods for the people that wanted the canned foods and other materials. This is what it looked like. And Maha's job here was to pack any fruits, and she'd go and hand it to me, and I'll put all the vegetables in here. And some volunteers had the opportunity to go downstairs and pack adult diapers, baby diapers, and sort out things that they needed help with, as you can see in the video. So some volunteers were downstairs in the basement helping out with other stuff.
Just Just looking at the past couple of clips, we can see this is what we do at HFSO, giving back to the community through food banks, one step of service at a time.
Next, let's go to the University of Toledo for raising a successful fundraising dinner. We're raising $950 in support of the education project with 23 attendees, including partner local school principals and university faculty. This initiative reflects the team's ongoing commitment to advancing educational opportunities and making a tangible impact within their community.
Now, let's look at our friends at Benedictine University, seeing what they do.
From having informational sessions about humanity first,
having GPMs, having tons of food. I sure want a donut. To having fundraisers for Palestine and boba fundraisers.
This really shows how an HFSO across the United States can make any type of change in any type of activity.
Every year, the Humanity First National Summit brings together student leaders from across the country, uniting HFSO chapters to learn, read, and launch change. Through workshops, panels, and collaborations, we explore how to respond to real-world challenges with empathy, strategy, and action. This isn't just about leadership. It's about building a generation to put service and community first.
Back when I was in Ghana, my native country, there were always people that came to our communities to help. And I'm not saying it was humanity first because I had no idea who they were at the
National
time.
Summit is also a great way to build friendship, relationships, and also have fun, being with others like-minded who want to make a difference in this world. Through the Get to Health initiative, students, regardless of the background in healthcare, have the opportunity to travel to underserved communities across the world and be part of something life-changing. Whether it's helping with intake, distributing supplies, or assisting physicians, every volunteer plays a role in restoring dignity and access to care. Just this March, the VCU chapter of HFSO traveled to Guatemala, where they impacted the lives of over 1,680 patients in just 1 week. This is what it means to serve directly, compassionately, and globally.
Like we have a dentist back at home, but we're using toothpicks in order to get this job done because we're just using the equipment we have today, but we're just carefully putting it around this little boy's teeth and see what we can do. Stop! My bad. We're at a local Guatemalan school, 20 minutes in Antigua. So here we're at serving majority kids because they all attend the school. So come with me. Pretty much here, it's around 8 in the morning, and we have all the people lined up trying to get their vitals so they can get checked up by American and Guatemalan doctors.
From local food drives to global medical missions, HFSO empowers students to serve and lead with purpose. You don't need experience, just the heart to help. Ready to be part of HFSO and start your own chapter? Visit humanityfirststudents.org/get-involved today to start your own HFSO.
Welcome to the Humanity First Student Division section of the telethon today, and we're so excited for you guys to join us. And we'll be going through a little bit of what HFSO and HFSD is to give you guys a little bit of information on what we do as a division. So just a little bit of vocabulary. HFUSA stands for the National Parent Organization that focuses on disaster relief and also human development projects. HFSD is a subsidiary division of all HFSOs. This includes 60 HFSOs all across the country, and that is the main Humanity First Student Division. Then we have HFSOs. So these are small organizations at universities like George Mason University or Virginia Commonwealth University for HFSOs. So currently, as of right now, we have over 62 HFSOs all across the United States. In just last year alone, we had over 19,000 service hours from all of our students and had $150,000 raised. And we want you to be the next HFSO. So we are joined by a couple of guests today. Their names are Bilal, Tanzila, as well as Arshan. And Bilal, tell me about your experience on Gift of Health and how do you participate?
Of course, yeah. So to me, the Gift of Health program means taking what we learned as students and using it to serve people in a real and meaningful way. It's not just about volunteering for hours or adding something to a resume. It's about being placed in a setting where people truly need care and realizing that even as students, we can still make a difference. During our March 2025 Gift of Health mission in Guatemala, RVCU Humanity First chapter joined a 30-member team made up of volunteers and physicians from the US and Guatemala. Over 3 days in Peronia and Alatenango, the team treated 1680 patients, provided fluoride treatments to more than 500 children, and referred 16 patients for free cataract surgeries through the Gift of Sight mission that followed. Our chapter also helped fundraise about $18,700 for medical and pharmaceutical supplies. As students, we were able to take vitals, perform fluoride treatments, help organize and dispense medications in the pharmacy, shadow doctors, and even help with patient evaluations under physician supervision. I think this program is a great way for students to participate because it teaches lessons that are hard to understand in a basic classroom setting. You learn communication, humility, teamwork, and cultural awareness. There are language barriers, but we still had to find ways to connect with patients through interpreters, gestures, and simple words. It showed me that medicine isn't just about knowing the right treatment, it's also about helping patients trust you and understanding their world. A specific memory that stayed with me was working
Let's move on to GMU and specifically Tanzila's experience being the president for George Mason University. So Tanzila, how was your experience being part of a local HFSO?
Yeah, Assalamualaikum. Thank you so much for having me. My experience being part of a local HFSO has honestly been extremely fulfilling, and I really owe that to the dedicated team around me. Over time, we have really found a flow as an organization, and every year we try to improve, learn from our mistakes, and build on what has worked well previously. As of today, we have almost 500 HFSO GMU members on our organization platform and 800 plus followers on our Instagram, which is our main source of information. Comparing this to when I first joined the board as vice president in 2024, we have pushed HFSO GMU to an average engagement and follower increase of 674% with about 28 events hosted in the past school year. So looking at our year recap, some of the events we consistently hosted included monthly meetings, bake sales, events, like mentioned before, and even a 5K for the Walk One Bike initiative. Through these different events throughout the past school year, our chapter raised a total of $5,889 toward various HF programs. Alhamdulillah. Being part of a local HFSO has also opened so many doors for us, both on campus and off campus. I've had opportunities to connect with local shelters, businesses, organizations, and community leaders while helping share Humanity First's mission. We held a charity lunch and iftar dinner this past year, partnered with local businesses, where each event had 150 attendees, and we informed them about HF Global's initiatives. And we raised a total of $1,608 for the Middle East Humanitarian Appeal solely from those events. But I think the best part of my experience has been helping establish HFSO as a recognized and trusted part of George Mason University, and seeing students now come up to us already knowing who we are, mentioning that they've seen one of our posts, attended a previous event, or heard about our mission from a friend is honestly one of the most rewarding feelings. So at the end of the day, on a college campus, it's more than the mission itself. It's about the environment that your club is creating, the events that we're hosting, and the invitation that we're extending to students to be part of something meaningful.
That's awesome, Tanzila. Thank you so much for giving us experience on that sense. Arshan, he's the representative for the Education Project. So Arshan, what makes the Education Project special, and what do we provide?
Absolutely. So what makes the Education Project so special is that we combine personalized academic support with a real measurable impact. And our mission is centered around helping students in underserved communities who may not have access to individualized tutoring or tutoring in general. And what makes our approach different is that we don't use a general one-size-fits-all model. We use tools like IXL, which help us identify exactly where each student is struggling so that tutoring can be more targeted and intentional for each student. What makes this organization special is the huge scope of our impact as well. As of right now, we have 176 registered tutors and volunteers across 15 states, showing how this has grown into a huge nationwide effort. And on top of that, our tutors maintain an average GPA of 3.8, which reflects the huge quality of support that our students are receiving through the education project. Our impact also extends internationally as well. Through our partnerships in Jamaica, we've been able to support students beyond the United States, which shows just how far this mission can really reach. And aside from just recruitment, there's real commitment behind the work that our tutors do at the education project. As of right now, we've contributed around 12,960 service hours, which has all been meaningful in helping students grow academically. But honestly, just beyond the numbers, what makes the education project so special is just the human side of it. Every tutoring session is like a chance to build a meaningful bond and an opportunity with each student, be a mentor for somebody and really bring that light into them, into someone who's struggling in school, and to uplift them. And what we provide at the education project at our core is just free individualized academic support for students. And we prioritize students in those underserved communities through our IXL and one-on-one tutoring models. And we provide data-driven learning support, which allows us to track exactly how each student is doing, how our tutors are doing as well, and what areas we need to address and change in order to benefit our students the most. We've gained, and so our IXL shows that students have gained an increase in 139.8 points in math, which averages out to about 1.4 grade level increase. And in English, they've gone up 38.6 points in just a few months, which shows a huge impact with the tools we're using right now. But aside from beyond academics, it's a lot of mentorship and a lot of mental benefit to not only tutors but students as well, allowing them and enabling them with the skills to take on the world and the challenges that it provides.
Thank you so much, Arshan. Thank you all for presenting about your experiences with HFSD. But I want to inform you guys about something that we at HFSD have been hosting annually every single year, and we would love for students from all across the country to join us. So every single year we host a leadership summit. Last year we hosted at University of Toledo College of Medicine. It had over 65 attendees. And here we do workshops to train to become a better leader, how to solve ongoing world problems, and also a networking way so that all students from all across the country can meet and also learn from one another. This year, we'll be hosting the National Leadership Summit at Michigan State University between August 7th and 9th. And hopefully, I hope to see you guys there because this will be an amazing experience. Thank you all for watching our HFSD experience and also learning about what does it mean to be part of HFSD. The future is all based off of students and also young individuals. We all need your advice, we all need your help and your passion to make what we need to do done in this world and ongoing crises. There are so many ongoing problems, especially at local universities and schools, but as students, we can rise up and make the change that we want to represent our future with. Thank you guys so much for joining the HFSD experience, and we will see you next time.
Regarding Humanity First UK, the ladies team is working with great dedication and passion. MashaAllah. They have done excellent work in recent years. I'm sure the women serving in Humanity First in other countries are also serving with great dedication. May Allah bless them all and enable them to increase their services in future. Thus, there is no doubt that with the grace of Allah, the scope of Humanity First work around the world is undoubtedly continuing to grow. As I said, the budget that was once in the thousands has now reached millions, and one day, inshallah, will reach billions. However, irrespective of finances, it is essential that all members of Humanity First always manifest an unwavering passion and commitment for serving others. Serving humanity is not a fleeting objective that comes and goes like the wind. Rather, it is a lifelong challenge, one that requires consistency and unshakable steadfastness. So it should not be that you work for a few days and then get tired or move on to something else. Furthermore, at every turn, you must seek the help of Allah. All your work should be conducted with humility and prayers. You should not desire worldly plaudits or praise. Rather, your only motivation should be gaining the love, nearness, and rewards of Allah, the Almighty, and a desire to fulfill the commands of the Holy Prophet ﷺ and the teachings of the Prophet ﷺ. Thus, now you have reached 30 years of service. Do not rest on your laurels or lie back in satisfaction. Instead, always look forward. Now is the time to plan for the next 3 decades. Now is the time to develop a clear vision for the future and to set ambitious goals. Now is the time to take humanity first to the next level. Your aim should be that the humanitarian services of Humanity First do not just increase gradually, but increase exponentially in the years ahead. Only then will this milestone and commemoration hold real value. Before concluding, I also wish to mention the volatility and instability of the world today. It is no exaggeration to say that the global economic and political situation is increasingly uncertain. Conflicts are erupting around the world. I have said many times, I fear we are drawing ever closer to a catastrophic world war. And if and when such a war occurs, resources will be scarce. Money or valuables will be of little value. Thus, Humanity First should prepare a comprehensive plan for how it will function and provide aid to those in war zones and affected areas. Whilst your disaster relief teams have some experience in responding to the earthquakes, tsunamis, floods, and other natural disasters, the fallout from a world war would be on a completely different scale. It would present an unprecedented, precarious, and complex challenge, unlike anything you will have encountered in the past. Indeed, it is even possible that Humanity First workers could lose their lives or severely injured in the course of their duties. Thus, you must plan meticulously and train your teams rigorously so they are prepared as much as possible. You should identify the specific areas where you can help, as it will not be possible for Humanity First to cover everything. Your priority should remain saving lives and alleviating suffering. I know some contingency planning has already been done, but it should be reviewed and developed further. Remember, at a time of profound crisis, selfish people look to protect themselves and their own interests. But as members of Humanity First, you must always set aside your own interests and needs for the sake of others. With these words, I pray that may Allah the Almighty accept and reward every sincere contribution, sacrifice, and act of service offered by Humanity First over the past 30 years. May all members of Humanity First, wherever they may be, serve with ever greater distinction and devotion. And may humanity first always live. Humanity first always live up to the noble aspiration with which it was founded. And may Allah, the Almighty, enable humanity first to shine as a beacon of hope and mercy for generations to come. Amen. Now, join me in silent prayer. Regarding Humanity First UK, the ladies team is working with great dedication and passion. MashaAllah. They have done excellent work in recent years. I'm sure the women serving in Humanity First in other countries are also serving with great dedication. May Allah bless them all and enable them to increase their services in future. Thus, there is no doubt that with the grace of Allah, the scope of Humanity First work around the world is undoubtedly continuing to grow. As I said, the budget that was once in the thousands has now reached millions, and one day, inshallah, will reach billions. However, irrespective of finances, it is essential that all members of Humanity First always manifest an unwavering passion and commitment for serving others. Serving humanity is not a fleeting objective that comes and goes like the wind. Rather, it is a lifelong challenge, one that requires consistency and unshakable steadfastness. So it should not be that you work for a few days and then get tired or move on to something else. Furthermore, at every turn, you must seek the help of Allah. All your work should be conducted with humility and prayers. You should not desire worldly plaudits or praise. Rather, your only motivation should be gaining the love, nearness, and rewards of Allah, the Almighty, and a desire to fulfill the commands of the Holy Prophet ﷺ and the teachings of the Prophet ﷺ. Thus, now you have reached 30 years of service. Do not rest on your laurels or lie back in satisfaction. Instead, always look forward. Now is the time to plan for the next 3 decades. Now is the time to develop a clear vision for the future and to set ambitious goals. Now is the time to take humanity first to the next level. Your aim should be that the humanitarian services of Humanity First do not just increase gradually, but increase exponentially in the years ahead. Only then will this milestone and commemoration hold real value. Before concluding, I also wish to mention the volatility and instability of the world today. It is no exaggeration to say that the global economic and political situation is increasingly uncertain. Conflicts are erupting around the world. I have said many times, I fear we are drawing ever closer to a catastrophic world war. And if and when such a war occurs, resources will be scarce. Money or valuables will be of little value. Thus, Humanity First should prepare a comprehensive plan for how it will function and provide aid to those in war zones and affected areas. Whilst your disaster
Assalamu alaikum.
Assalamu alaikum.
Alaikum assalam.
We are welcome back to the studio as we come to the concluding session of the Humanity First USA Telethon. We have one of the most vital organs of the organization, which is the ambassador program around the country. There are ambassadors in all chapters of the Ahmadiyya Muslim Community USA and other areas where they promote, support, and bring in new donors who want to give of their time, talent, and treasure. We have various people online with us right now, and we will see who's with us. But how's the fundraising going?
Yeah, I think we're getting the final numbers in a minute, but
I saw 838, but you said it's higher.
Yeah,
838,000. That's amazing.
Yeah. I think, with the pressure that we were feeling due to the economy and everything else, it was a really difficult challenge. But I'm very happy that we have reached to that number there. We'll get the final numbers in a minute.
And I saw a lot of Mother's Day gifts from donors from around the country.
Excellent.
I saw Jawad Malik, Shoaib Mohiddin in Florida, Jawad Malik in California.
Right,
I saw Zara Ahmed in Zion. Many others. Samir Habib in Texas, Joy Ba in Illinois, Nuruddin Shams in Zion. Many individuals. Nasreen Muzaffar in Virginia, Hassan Shah in Florida. We just have many individuals participating, and many who wanted to remain anonymous. That individuals, it's interesting we chose to do this on Mother's Day. I don't think it was coordinated, but it allowed people to recognize perhaps the most important person in their lives.
Absolutely. I think timing was perfect, and for mothers, people should do and people are doing things. So very nice.
That's great.
And I think, we normally in this, as you know, in this session, right, we bring our ambassador team, right, to the frontline people. Tahir Kamar and Zara Kamar Sahaba, they're both leads.
So the latest number I got is 865,000 now.
Excellent.
So it's still growing. I think we can still hit 1 million.
I think it after it closes, you keep seeing the number coming
We'll
in.
hit
So
1 million.
we'll not announce the final number. We will thank on.
We'll do it online.
That. But let's talk to
I
who's
want
online
to see
with
if
us.
we have any of our individuals online and see if we can get them. Can you hear us?
Yes. Assalamu alaikum.
Walaikum salam. That's
yeah.
great. We are here in Cote d'Ivoire. You are in USA, but I'm glad we're together. Tahir Saab, can you share some of the stories of our donors and the ambassadors?
Jazaak. Assalamu alaikum. First of all, I want to say thanks to Allah. Alhamdulillah. It definitely not possible without the prayers of Hazur. As Munam Sab knows that I tend to write letters almost every other day. And because with Barakat of Khilafat, we are able to do that. And I have seen that over year after year, the same miracle happens. And as you know, this year we had a really rough time, back-to-back campaigns, and we heard that, it is not possible, it will be hard and all that. Munam Sahib is very much aware of that. But I just chose few people who have done not only, there are a lot of good ambassadors who has done great job in last 1 year. But specifically, I would like to highlight Dallas, Zion, Munib Bhai from Orlando. These people have not only done in Zion, they have tripled their target. So again, I'm not going to point Mumtaz Malik from our own Jamaat. So there's so many examples that we have that every time they have done dinner. Just to take an example of Dennis, Salman Akram Sabhir here, he probably give better details. But I just want to say thanks to every single ambassador who has done great campaigns, and they showed us that it is possible that we can do campaigns if they really put their heart in. So I'm not going to take all the, don't want to take everyone's time, but I'd like to introduce here, we have Nasir Sahab and Sister Mubaraka. Then we have Dr. Ehsan Sahab, who is our regional director for South. Then we have Salman Akram Sahab from Dallas. And then last from not least, who's left now? If I missed some name right here. So anyway, I'll just leave it. We can start from Nasir Sahab. Nasir Sahab, since you tripled that, let's start. How was your experience with Sister Mubaraka?
Well, first of all, I have to give credit where credit is due. It was all her, my wife. My job was just not getting in the way. But one of the things that we did was we made sure we contacted every single person in our Jamaat and emphasized the fact that, this is the easy part. The tough part are the volunteers who are out there on the front lines. They're sacrificing their time, their convenience, taking vacation time from work. Those are the real heroes. I mean, and we get to partake in their blessings because the easy part is just throwing in a dime or two. So we wanted to make sure everybody was part of this initiative, and by the grace of Allah, we received a great response from our Jamaat, as well as many people outside of our particular Jamaat. Mubaraka happens to be the principal of the National Online Tahir Academy, and we received a great response from them as well, by the grace of Allah.
MashaAllah. Jazakallah again for your efforts. I know you have done every campaign one after another. There's no second thought. I really appreciate that. And now, Salman Akram Sahab, you and your sister Taiba from sitting in, I would say, Pakistan, she was able to do miracles from there too. So I really appreciate Sister Taiba from there. And Salman Akram Sahab, please go ahead if you want to share something with us.
Jazakallah Tahir Sahab. I really, really appreciate all your kind words. Yes, it is team effort, not definitely an individual who made it happen. As you know, right, we all feel the heat of the economy these days, job losses, rising costs, and all that. And I'll be honest with you, I'll just share a quick personal story. I was in a similar situation last October when I was feeling these job situation uncertainties and hurdles that everyone's going through right now. And the weight of those challenges was actually building up a lot last year. But it's all the ambassador team support, Sister Taiba, you mentioned, that we managed to pull through each time we're given that target. And, it's really, obviously, it's the unwavering support from Allah and then the prayers of the Khalifa. But it's really the building the trust with the donors, I felt has been the key for us. Being authentic and in sharing where the lows are, where the highs are, and building those one-on-one relationships. I think it worked a lot in our favor, and I think I just want to give credit where there's due to all the donors who help us in every situation. It's about authenticity and building that trust one-on-one.
Sagla Salman Bhai, I know you have done a great job in the dinner as well. We will take some guidance from you because we are going to be in LA soon. Saif Bhai is here, right, Saif Bhai?
Yes,
so he came back from his sickness and he was able to still deliver and he's working hard. And finally, we see LA doing some great job this year. So Jazakallah Saif Bhai, and I'm looking forward to come with Munam Sahab for dinner there as well. So go ahead, please.
Inshallah, we're looking forward to having you. And it's still early here on the West Coast, so inshallah we'll get our target reached with a few more hours. So calls are still being made. So. But inshallah, we definitely would love to have some interaction with the national team coming out over to LA to reintroduce to some of the younger crowd that we have now that have actually now started working and getting jobs, who used to volunteer their time quite a bit while they were students. And I think now reaching out to them, since many of them are busy working with families, but getting them on board. So inshallah, we're
Jazak Safai, if I can just jump in, this is Mac. Mac, since you started Tahir Kamar Saab, we were at 865,000, and then as of 3 minutes ago, we hit 900,000, and now we are at 968,000 3 minutes later. So whatever you're doing, keep doing it. Safai, I know you're on the West Coast. Keep doing what you're doing because we're almost there.
Yeah. Just one more thing. As Saif Bhai is there, is a camera. I can't see him if he's there.
Gee, I'm here.
Jazakallah Hassan Bhai for joining. I know it is a short, but Hassan Bhai used to be our ambassador from Orlando, and he really did a great job there. And he one of those who gave us his backup, one of the grades too, Munib Bhai. So I am hoping we have now Ahsan Bhai back as a regional director for South, because we have some chapters where we really need his help. So we requested that let's bring a different regional structure in based on Munam Saab's guidance. So yeah, Ahsan Bhai, if you want to share something with, first of all, thanks for your great generous donation. I don't want to number that, but I really appreciate your great generous donation. And please go ahead. Ahsan Bhai, you're saying something? I think maybe not. So okay, so Munam Saab, we can go back, and if you have any questions for these, because they really.
So I do want to say thank you to all the ambassadors, as you mentioned, and actually I have a list that I will go over, but to ambassadors being the frontline people, and you and your wife Zara Kamar Saiba, both of them have just worked tremendously hard, getting all of these ambassadors excited, and I think the work is shown there, and you just announced the total donations also. But so thank you to all the ambassadors and the special ambassadors which were on there representing the whole team. So I just want to say thank you. But we have one more person. I think Tahir Sufi Saab, we missed. We brought him in this line here. He was representative of Ansarullah, as well as he's our food pantry program lead. So let's see if Tahir Sufi Saab is on. Okay, looks like he lost his second chance. Tahir Sufi Saab, you're not there?
Yeah, he's back.
Okay.
I know he's coming.
All right. That's Sufi Saab. Maybe I think the Zoom does not like you or something. This is the second time we are missing you.
While he comes, this is incredible. We're practically at $1 million fundraised. We've seen the healthcare work, we've seen food pantry, we've seen disaster relief, and many other programs coming together. And this ambassador program is truly remarkable in how they work house by house. I mean, I now live in Long Island, the ambassador in Long Island, just like in Silicon Valley, reaching out to individuals, creating their own group, truly grassroots connecting with Ahmadis and non-Ahmadis to encourage them to give. I mean, it's not only the dollar amount, but the amount of donors that we have is pretty incredible as well.
Absolutely. And then I would also like to recognize our lifeline donors. There are donors who give consistently every month, small amount, large amount. There are donors who give us a large amount every year, and we call them, lifeline donors because they major programs. Then there are efforts from the ambassadors, and then those people who get moved when these type of things are shared. So I think we are really thankful to all of them. But you're right. I mean, this to me was kind of again, you think that this goal is impossible when you see the situation, but it's all efforts and prayers of Azul.
In closing, I'd love to hear your thoughts on where we go into this new year. I mean, it's Marvelous Day as Mother's Day, and I know a lot of people have thought about their mothers. I remember meeting your mother and attending her funeral as well. Tell us about your mother.
Yeah, I think my mother passed maybe back in 2021, passed away, and I learned a lot from my mother. She was very loving, caring, very prayerful, and she would push me to go serve the Jamaat. And she knew that I was busy all day, but every time I would go out, she will give me handwrite a lot of prayers. Pray for safety, pray for this, pray for this, pray for this. Every time, and she would, give me a bag which will have some Tums, which will have some candies, some nuts, and something that, because she knew that I work hard and I forget to eat, and she will do that. And so mother's love is totally different. Again, it's like we have this program. I did a couple of water wells in her name, and then you continue to do charity, and I offer 2 nafils for my parents every night. I think everybody does that because those are the blessings. But so happy messages to all of our.
Thank you for sharing that wonderful story. And I would encourage all our individuals, even if they've already given, to give at least a little bit in honor of their mother. And there's a lot of benefits, and the Tums, the finer points is a great story. In closing, any closing thoughts from you?
I think so. First, I want to say thank you to some people. So I'm just want to.
Please.
I know I'm going to miss a few people.
Please.
But I think I will still do it. And if I miss somebody, I apologize. So first of all, I started out with Majid Saab. From setting up this
Majid
place
Khan
here,
Saab.
Majid Khan Saab, that setting up this telethon in Ivory Coast and giving whole world another view of looking at things from there. So and the team who had no experience here, they work hard. The local Ivory Coast team, I just
incredible.
Salute to them.
MTA Ghana, amazing.
Then next is MTA Ghana.
Yeah.
I mean, they did such a beautiful job. So I'll again say thank you to them as well. Then Mac, I think.
Can I interrupt you? Yeah. We've just crossed 1 million. Sister Nadir Salek is incredible. Majid Khan Saab was saying she's the most valuable player on this team in a lot of ways. We're at 1,080,000 now, mashallah.
Alhamdulillah. This is kind of a something that is very inspiring for me. $1 million passing the goal on that. Then I just want to say, Mac, for you to join us also. And this I think you've been a wonderful host there. And then I will start with USA team. Hamid Malik Saab, Waleed Saab, Asim Malik Saab, Fahim Pal Saab, audio video person there, and his whole team. Sister Nudrat, you mentioned. Sister Ismat is working in background. Elena is working in background. Tahir Kamar, Zara Kamar Sahaba, Tahir Sufi, Sabah Naeem and her team. HFSO team was there on the program, and then we saw the ambassadors, and we saw our Kids for Humanity team. Some of those programs were wonderful. I watched them. Then I want to say thank you to all of the donors also, and also to respected Jamaat office holders that came today from auxiliaries and also from various offices, and Amir Saab himself, he wrote a beautiful message that he was not able to join, in the session, but always his shafqat is great for us, and I get guidance from him, and then I'm thankful to Hazur for his prayers, because like Tahir Kamar said, he writes to Hazur and I write to Hazur in panic also for praying all that. So all of these people, I just want to say my appreciation. If I miss anybody, I apologize. And inshallah, Hazur has given us a target for the future vision, and we have our 5-year plan laid out. We'll work on it, but I think we are very encouraged, and I think we can just unless otherwise you have any last minute questions.
So it's about 9 p.m. now in Cote d'Ivoire. It's probably around 4 p.m. in the East Coast, and 5 p.m. on the East Coast, and 1 p.m. on the West Coast. And I think more people will continue to give, but if we can now sign off and allow people to continue to give, continue to recognize Humanity First. I think the website is a great place for individuals to continue to come back. They can follow the progress throughout the year.
Absolutely. I think we can close the session with silent prayers. I think I just want to make sure there are more last minute messages, but I think we are good for right now. So let's all of us please join in silent prayers. Thank God Almighty who has given us this opportunity to serve people and all the hard work that you did. May Allah bless all of you, and let's pray together. Ameen.
My mother-in-law did end up giving, just because she's alive, so she gave herself for the solar water pump. I just got that message, and she's over 80, and she gave online, so it's working. The tech is working.
MashaAllah. I think this is excellent. That's a good story.
Thank you. All right, we're off.
Thank you.
Assalamualaikum.
Before the day begins, the search begins. Across dry fields, down narrow paths, families walk for hours just to find water. But with Humanity First's Water for Life program, we're changing that, one village at a time. We've built 406 water wells across 7 countries, bringing clean water to over 350,000 people. Through Humanity First's disaster relief program, we're there in the earliest hours and in the long months after. Our teams deliver critical care, food, water, medicine, and emergency aid in more than 50 disasters across 24 countries, reaching over 2.5 million people. Through Humanity First's community care program, we support those who are often left behind, both in Canada and across the globe. In Canada, over 700 seniors have been supported through our Seniors First initiative, offering wellness sessions, field trips, English circles, and food security. More than 2,200 people have accessed our free tax clinics, including low-income families, students, and newcomers navigating complex systems. Humanity First's food security program is making sure that no one is forgotten. In Canada, our Feed a Family food bank serves over 3,000 people every month, delivering more than 100,000 food hampers and 15,000 home deliveries, helping families overcome barriers and rebuild stability. We've also served over 30,000 hot meals to those facing homelessness, offering not just food, but compassion and community. Internationally, our Feed the Hungry initiative has reached 4,000 villages, bringing critical food support to over 1.8 million people. Through Humanity First's Gift of Sight program, we're restoring vision and restoring lives. In just 20 years, over 3,000 cataract surgeries across 2 countries. For millions, the right to health is still out of reach. That's why Humanity First's Global Health Program brings care beyond hospitals, into villages, camps, communities where no one else goes. Across 5 countries in Africa and South Asia, our network of mobile medical camps, permanent clinics, and hospitals has treated over 130,000 patients free of cost. With Humanity First's Knowledge for Life program, over 32,000 lives have been touched by building schools, transforming classrooms, and building futures. We run 10 schools from the mountains of Haiti to the islands of Philippines. We've equipped over 7,000 students with school supplies to continue learning with purpose. In Humanity First's Orphan Care program, we help children regain more than just stability. We help them find family. In 3 countries, over 150 children have been placed in loving homes. For thousands fleeing war, persecution, and displacement, Humanity First is a doorway to a new beginning. Through Humanity First's Refugee Resettlement program, we help turn hope into something real. Since the program began, over 5,000 refugees have been resettled across over 10 countries. From the moment they land, families are welcomed with furnished homes, warm clothing, groceries, and guidance. Because care isn't just comfort, it's a foundation for belonging and a spark for humanity.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome to Humanity First Canada Global Telethon. We are located in city of Vaughan in Canada. And today our objective is to create an awareness of Humanity First programs, especially the programs that Humanity First Canada is doing in Canada and globally. We are located in our head office, which also has a food bank, and this food bank serves over 3,500 people every month. We're going to give you a short tour of our food bank, and we'll also talk to some of our volunteers who are currently helping the clients. In addition to that, we are going to tell you about our Refugee Resettle program, which is our flagship program in Canada. And under this program, we have helped thousands of displaced people to resettle in Canada. We are also going to tell you about our activities in last few years in various countries in Africa and some other third world countries. First, let's go and see what is happening in our food bank.
Humanity First Food Bank volunteers work 7 days a week to send food all across Canada. As soon as we get a phone call, we begin the intake by noting down the list of needed items. We then enter the items into our food bank system. After this, the food bank worker will print out the list. This list is taken to the warehouse and the volunteer begins to pick the items from the shelf. Our volunteers gather all of the needed items onto the warehouse table. Once all of the items are brought to the table, the volunteer begins to pack them into boxes. Our volunteers make sure to place the heavy items at the bottom so that no fragile food item could ever get damaged or crushed. The box is neatly organized and filled all the way to the top. The assembled food hamper is then sealed with a sticker. The sealed package is taken into the delivery room for pickup by the driver. When the driver arrives, the food boxes are placed into the Humanity First van for delivery. In the end, the food hamper is delivered straight to the doorstep of the client.
Fighting hunger isn't just about filling plates. It's about building resilience, restoring hope, and creating opportunities for a better future. At Humanity First, we've supported over 1.9 million people across 16 countries. From food banks here in Canada to rural villages around the world, Humanity First's food security program is making sure that no one is forgotten. In Canada, our Feed a Family food bank serves over 3,000 people every month, delivering more than 100,000 food hampers and 15,000 home deliveries, helping families overcome barriers and rebuild stability. We've also served over 30,000 hot meals to those facing homelessness, offering not just food, but compassion and community. Internationally, our Feed the Hungry initiative has reached 4,000 villages, bringing critical food support to over 1.8 million people. 6 million volunteer hours, over 1,000 volunteers, 16 countries, one mission: to fight hunger, to build resilience, and to serve humanity.
You have just met some of our volunteers from Food Bank. Today is a bit slow day. Usually there are a lot of volunteers and a lot of clients waiting for us to help them out. You saw them packing food, delivering food, and also they were helping clients in the front with their other needs. Under the Refugee Resettlement Program, we help people to resettle in Canada when they are displaced in a third country where they are temporarily there waiting for resettlement. Humanity First is a sponsorship agreement holder, a private sponsorship program where we sponsor refugees, and when they arrive in Canada, we receive them at the airport and provide them accommodation and provide full support for 1 year, which includes getting children to the school, healthcare, and other documentation requirements. We complete that for them. This is a program which has changed lives of thousands of people. Let's meet a couple of refugees now, and you can hear from them the first-hand story.
I'm Sajid Ahmed, a member of the Humanity First Canada Refugee Resettlement Team. HF Canada sponsors refugee through the private sponsorship of the refugee program. We support individuals and families who have been forced to leave their home countries due to the serious persecution. After the application process is completed, we welcome them at the airport and assist them with their immediate needs, including food and shelter. Our team provides various support to help the refugee rebuild their lives, become self-sufficient and successfully integrated into the Canadian society. Our goal is to empower them to contribute positively and meaningfully to their new communities.
Assalamu alaikum viewers. You're watching Humanity First Global Telethon, streaming from Humanity First Canadian headquarters, located in the city of Vaughan, Ontario. As we all know, that Humanity First is at the forefront of sponsoring and resettling refugees in Canada. I'm very fortunate to have one of our sponsored refugee with me today. I would like to welcome Lubna Wahid Saba in our studios, and I invite her to share some of her experiences of coming to Canada, especially at the arrival. Lubna, how are you today?
By the grace of Allah, I'm pretty well. Thank you so much for asking.
How is everything going?
Alhamdulillah, everything is going pretty good.
Would you like to shed some light on your arrival when you came to Canada?
Yeah,
By the way, which year did you arrive here?
I arrived here on 2019.
Okay.
Yeah.
Okay, and then tell us about your experience.
It was a great experience when I arrived on the airport, and I feel so tired, but I was wondering when we land here. So I see the humanity first workers, the volunteers. They treat us very kind, very professional. I was quite happy, and I feel free when I.
It was a warm welcome.
Exactly, it was quite warm welcome. It was heart-touching moment. I feel so happy and satisfied.
And blessed.
Alhamdulillah, blessed.
And tell us about the accommodation arrangements after the arrival and once you were received at the airport. Were there any accommodations available?
Yeah, exactly. When I went to the home and I saw like everything, the home was furnished, even though grocery was already there. So yeah, exactly. And I was so satisfied, and I don't need to do anything. It was furnished, food was already there, each and everything.
Very nice, very nice. This is what our volunteers do, and they have been doing this service for many, many years. Incredible service supporting refugees from the reception at the airport to accommodation, and then on in an ongoing basis. You know, all this incredible work is done by tremendous volunteers who are doing this service selflessly with so many refugee families. Are you volunteering with Humanity First, or you are planning to volunteer in future?
That's a good question. Actually, right now, at this moment, I'm not doing, but inshallah, I would like to do the volunteer in Humanity First.
Yes, definitely. You should contribute and give back to the community.
Sure.
We have assisted you, and you should, give back to the community through Humanity First platform.
That's a big opportunity for me.
So do you have a message for our volunteers, our donors? Because without them, we cannot extend our services to people in need.
Yeah, sure. I would like to say, please donate it in Humanity First, because I was also survivor, and in Canada or worldwide there is a lot of people who already survive in many stuff, like financially, physically, mentally. They have no house, they have no food, so we need to help. If you help, so God will help you. So
Definitely.
I will encourage you, so please donate, because one single penny gonna help the other kid, help other people.
Yes.
Thank you so much.
That's very true, that every single act of kindness come back to us with lots of blessings in return. And with this, I would like to end this segment with a message to all my volunteers and supporters to please continue supporting Humanity First, because without your support, we cannot continue this good work. Thank you very much. Jazakallah.
You pack what you can carry. You leave behind your home, your work, your memories, maybe even your family, all for one thing: the hope of safety, of freedom, of a future. Through Humanity First's Refugee Resettlement Program, we help turn hope into something real. For thousands fleeing war, persecution, and displacement, Humanity First is a doorway to a new beginning. Since the program began, over 5,000 refugees have been resettled across over 10 countries. From the moment they land, Families are welcomed with furnished homes, warm clothing, groceries, and guidance. Kids are enrolled in school. Parents are supported through orientation, employment training, and legal help. Some find new careers, others return to school. Many reunite with family after years apart. Because we don't just help them arrive, we walk with them through every step, rebuilding their lives, restoring their confidence, and rekindling their dreams.
Welcome back to Humanity First Canada studios. Today we are trying to create an awareness through this global telethon, and you have today heard about the Humanity First Ivory Coast Hospital, which is being built with support from Humanity First Canada and UK, and other countries are also supporting this major project right now in front of us. But did you know that Humanity First Canada is already running a hospital in Senegal? This is a 35-bed full-service hospital, which is providing medical, surgical, OBGYN services and other lab and X-ray, ultrasound services to the people in need. This hospital is providing help at no charge, no cost to the patient, or at a subsidized cost to those who can afford that. This hospital needs a lot of help. This has been running since 2019, and many equipments are outdated. We want to make an appeal to you to please support this hospital. We are looking for donors who can really help us in getting an elevator in that hospital. We want to really install an elevator to reach out all 4 floors at this hospital. We are also trying to renovate our 2 theaters, and for that we need surgical supplies. So you can make a pledge or make a donation today. We are looking for donation amounts, any amount really, but a good amount would be anywhere from $5,000 to $50,000. For $5,000, you can buy supplies for our hospital. For $10,000 or $15,000, you can replenish our supplies and equipment in our lab, or you can help us with $20,000 or $30,000 or $50,000 for some major equipments like X-ray machine or the elevator or ultrasound machine. So those are the things that we need at this hospital. So your support is very much needed to continue to help this hospital provide free and subsidized services in Senegal. Let's take a quick shot of this hospital and we'll come back.
Under our global health program, the brand new 35-bed Humanity First Hospital in Senegal, the Masrour Centre Médical Social, is ready. The hospital has medical and surgical facilities, X-ray and ultrasound imaging, a medical laboratory, and ICU facilities. We are also working on setting up 2 more medical centers in Nigeria and Congo. Under our Gift of Sight program, we have conducted over 500 cataract eye surgeries per year over the past 3 years. That is, over 1,500 people are now able to see due to our generous donors and supporters.
Welcome back. Humanity First Canada, in addition to the food bank, the food security program, the refugee resettlement program, and the global health program, is regularly conducting eye surgeries in Nigeria and in Tanzania. And we are doing about 100 eye surgeries every month. They are really a low cost, huge investment where we restore life and make a change or a difference in the lives of many people. These surgeries cost only about $120. With your support, with only $120, you can change somebody's life and you can make someone's life easy by such a small amount of donation. You can also sponsor 10 surgeries for $1,200 or 100 surgeries for $12,000. Imagine if when you go to a restaurant and you're a family of 4 or 5 people, you spend about $200 to $300 on food. Now, for that amount, you can help 2 or 3 patients. Now, if you skip your 10 visits in a year, you can really help 10 patients or maybe more. So we really want you to come and support Humanity First Gift of Sight program. To make a donation to Humanity First, it's very easy. You just have to go to our website, which is humanityfirst.ca. Again, it's very simple, humanityfirst.ca. Click the donate button. There are 2 options. Either you can donate one time or donate monthly. You can select any amount. No donation is small. You can donate $10 to $20 per month, or you can make a one-time donation for $5,000, $10,000, $50,000 online. You're going to get a tax-deductible receipt immediately, and that money that you donate will immediately help someone in a third world country.
Assalamu alaikum viewers, welcome back to Humanity First Global Telethon from Canadian studios. I would like to highlight one of the very famous and most important program of Humanity First, which is Water for Life program. Under this program, we drill and build water wells in so many countries where water is in acute scarcity. With this, I would like to invite our donors and viewers to continue supporting Water for Life program. And you know, most of our donors are women. So I encourage all my sisters who are watching this telethon at this time to donate for Water for Life program, build a water well in a remote village, remote area where there is no water available within the close proximity of the village, and people are walking miles and miles to get just one pail of water. With your help, their life will be changed. You will be a game changer in their lives. Their children can go to school instead of spending time in fetching water from various poor sources. If you are interested in making a donation for Water for Life program, please go on our website and make a donation. The website address is www.humanityfirst.ca. You can also call us and we can make a donation on your behalf. You can call us at 416-440-0346, which is the number for our Canadian headquarters, and we will make the process your donations. Thank you very much. Jazakallah.
Before the day begins, the search begins. Across dry fields, down narrow paths, families walk for hours just to find water. But with Humanity First's Water for Life program, we're changing that, one village at a time. From water wells in South Asia, to electric boreholes in Africa, to hand pumps in South America. We've built 406 water wells across 7 countries, bringing clean water to over 350,000 people. But it's not just about access. It's about dignity, safety, and sustainability. That's why we train local teams to maintain their systems, ensuring long-term impact for years to come. Because when water flows freely, so does opportunity, health, and humanity.
In a couple of weeks, we are going to celebrate Eid al-Adha. This celebration, which is very important for all Muslims around the world, has one additional significance. During this celebration, a lot of people, and we are talking about hundreds of thousands of people, have an expectation. They expect that this will be an opportunity for them and their family members to eat meat. They're going to get protein, for which some people wait for the whole year or many months to be able to eat fresh meat. When you make your Eid al-Azha sacrifice through Humanity First, thousands and thousands of people in remote villages of many countries benefit by getting protein in their diet. Let's make a sacrifice, Eid al-Azha sacrifice with Humanity First, and enable these people to receive meat products. To make a Qurbani through Eid is very simple. You can go to humanityfirst.ca website and select Eid Qurbani, and you can make a donation. Or you can go to humanityfirstcanada.ca/Eid-Qurbani website, and you can select the option that you want to donate. A lamb is going to cost you only $199. A goat will cost you about $250. A share in a cow is $150. And a full cow, which has 7 shares, is going to cost you about $1,050. So again, go to humanityfirst.ca, click donate, and you will have the option to make your Eid al-Azha sacrifice. Thank you very much.
Assalamu alaikum viewers. This ends the Canadian segment of the Global Telethon. We want to thank you for your continued support in helping support Humanity First and helping in its mission to help serve mankind. It's through donations like yours that help make Humanity First what it is today and help take it to the next level. So thank you. Jazakumullah khairan. We'll now send you back to the international projects.